Thank you very much. Excellencies, honorable ministers, esteemed Director General and Regional Director of the WHO for Europe, distinguished representatives and guests, welcome back. Before we open the discussion on the issues raised by the Director General and by the Regional Director in their two addresses, first I have noted that the Russian Federation has requested the floor for a point of procedure on a previous agenda item. So, Russian Federation, you have the floor.
Россия имеет замечания по процедурным вопросам. Мы против предоставления Европейскому Союзу статуса постоянного наблюдателя в региональном комитете. Вопрос ранее не обсуждался, и учитывая новый формат проведения регионального комитета и другие вопросы, считаем, что он требует дополнительного согласования и обсуждения со странами-членами ЕРБ ВОС. При этом мы считаем, что необходимо соблюдать правила процедур и выносить этот вопрос о статусе наблюдателя на голосование перед каждым заседанием регионального комитета. Спасибо.
Thank you very much, Russian Federation. I would now like to see if Germany, on behalf of the EU, if Germany would like to comment on the intervention by the Russian Federation. Germany, you have the floor.
Thank you, President. And I'm speaking again on behalf of the EU. Obviously, we didn't want to take anybody by surprise. This is why the EU has shared the statement on Friday last week with the Secretariat, with the view that it would be shared with all delegations. Our EU introductory statement has been read out since the year 2001, so practically for the last 19 years without any opposition by any delegation of the Regional Committee. We believe we all have an interest in making this session more effective, and this is exactly why the EU has proposed not to read out the same statement again and again in the future. Our understanding is that the committee has already agreed on the way forward, but obviously, as already clarified by the President, it can be revoked anytime. Thank you.
Thank you very much, Germany. I have noted the suggestion by Germany that this can be revoked at any time, and I would then like to suggest that we will table this as suggested by the Russian Federation, the need for further discussions. I would now suggest that we will table this for discussion at next year's RC 71. I see no objections to this proposal. So we will now move on. Thank you very much. So this will be discussed at the RC 71. Before we open the discussion on issues raised by the Director General and by the Regional Director, we will first have the privilege to listen to a short intervention made by Professor Mario Monti, President of Bocconi University in Milan, Italy, and also the former Italian Prime Minister, as well as a former European Commissioner. Professor Monti will make the statement in his capacity as chair of the newly established Pan-European Commission on Health and Sustainable Development, to which the Regional Director also referred to in his talk. Professor Monti, you have the floor.
Your Royal Highness, President, Director General Tedros, Regional Director Kluge, Ministers of Health, ladies and gentlemen. It is a great pleasure for me to be with you today. The COVID-19 pandemic has been a monumental stress test for health and social care systems across our countries. It has thrown light on the huge inequalities of our modern world. On the other hand, this stress test provides us today with an unprecedented opportunity to rethink health and social care systems in a long-term perspective and in the wider frame of economic and social policies, which is itself to be reconsidered in the light of pandemics. A few weeks ago, Hans Kluge approached me with an ambitious idea. He wanted to convene a group of scientific, economic, and political leaders, not currently in office, who could offer forward-oriented and actionable policy recommendations for consideration by government leaders across the European region. Your regional director's vision gained the strong support of Dr. Tedros. They persuaded me, and I was honored to accept the chairmanship of this group. So the Pan-European Commission on Health and Sustainable Development was born. The timeliness of Hans's idea was immediately tested. None of the personalities that he and I called, among them 3 former heads of states and 2 former prime ministers, declined the invitation to serve. This independent, non-remunerated commission will take a magnifying glass to current economic and social policies, review evidence on their performances, and make recommendations on how possibly to prevent future crises and how best to respond to them. A scientific advisory committee coordinated by Professor Elios Mosialos will support our work. The Commission held its first meeting on 26 August. We have committed to deliver a set of policy recommendations in 1 year from now. In order to promote a novel political thinking on the priority for health and sustainable development on governments' agendas and build consensus at the highest political level, we need to establish partnerships with member states. I trust we can count on your valuable engagement and expertise as we are about to sail these uncharted waters. Thank you very much.
Thank you very much, Professor Monti, for these very inspiring words. We certainly, all of us, look forward to the presentation of the Commission's report at next year's meeting of the Regional Committee. And we also hope at that time to have you with us here in Copenhagen. At the request of the President, I will now, in my capacity as Executive President of this 70th session of the Regional Committee for Europe, lead the discussion and manage the speakers list for the discussion on the issues raised by the Director General and by the Regional Director in their addresses. So I now open the general debate, which will give delegates the opportunity to make statements on both presentations, but also on topics not covered elsewhere in the program. The Secretariat has received requests from several delegations in advance of our session today to take the floor on this item. This also includes pre-recorded video statements. We will first take these interventions and then move to any additional requests made during this session. Delegates or delegations not yet on this pre-established speakers list, but also wishing to speak, can use the raise hand function in Zoom. If this wouldn't work, please then use the chat function in Zoom to inform the Secretariat of your wish to speak. After we have exhausted the interventions by the member states, I will also invite representatives of partner organizations in the same way. Let me also repeat the President's request to observe the indicated time limits for interventions in order to ensure an effective conduct of the meeting and to focus your interventions on the subject under discussions. Since we are expecting a long list of speakers, Also, on the next agenda item, it will be important for interventions to be concise so that we can close today's proceedings as planned around 4 p.m. Copenhagen time. I now give the floor to the delegate of Germany on behalf of the EU, to be followed by the delegate of Italy. Delegate of Germany, you have the floor.
Dear President, Regional Director, colleagues, I'm pleased to speak on behalf of the EU and its member states at the 17th Regional Committee, a special one in many respects. The candidate countries Montenegro and Albania, as well as Ukraine and Armenia, align themselves with this statement. The COVID-19 pandemic is still ongoing. At the same time, we have entered the phase of evaluation and lessons learned, both at national and international levels. We welcome the start of the process of independent evaluation of the COVID-19 response as requested by Resolution WHA 73.1, and would like to thank the DG as well as the IPPR co-chairs for their efforts. We are looking forward to meeting the co-chairs at the special session of the Executive Board and to learning how they plan to engage with member states in a transparent way. A global, collaborative, inclusive and coordinated response is imperative, now as well as in the future, to prevent, prepare and respond to and defeat pandemics and their impact. This was the purpose and tenor of COVID-19 response resolution adopted by the WHO in May. A global response will not be possible without solidarity. We recall in particular the recognition of vaccinations against COVID-19 as a global public good and confirm our commitment to ACTA, including the COVAX facility. Member States' expectations vis-à-vis WHO by far outweigh WHO's financial, structural and legal capacities overall, but in particular in pandemic preparedness and response. Without prejudice to ongoing evaluations, we take the view that an inclusive discussion about the strengthening of WHO and potential steps of reform should start as of now as an input to these processes. Regarding WHO's funding, we should both consider the size of the overall program budget and strive towards more predictable and flexible funding. WHO's work in emergency response is especially underfunded and should be further strengthened. We consider it crucial to have a strong monitoring and oversight system in place and ensure full transparency and proactive communication with donors. A review of the international health regulation is equally needed with a view to strengthening its implementation and reviewing, for example, the PHEIC alarm level system. WHO's normative role and capacities should also be strengthened. The EU is committed to playing an active role in strengthening WHO and more generally global health as such. We have worked very closely with the WHO and the EU neighbourhood countries and mobilized very substantial support to address the COVID-19 outbreak. Director General, cross-border disease outbreaks like Ebola and COVID-19 cannot be seen in isolation. Health system strengthening, climate change issues, animal and human health, antimicrobial resistance and non-communicable diseases are all interlinked and interacting. WHO, with its broad mandate, is well positioned to play a key role. The current focus on COVID-19 should not divert attention from WHO's work in these and other essential areas. We have and do appreciate your and your team's dedication and efforts in often very difficult circumstances. Thank you for your leadership in fighting this pandemic. Regional Director Kluge, you started your tenure under difficult circumstances. Under your leadership, the Regional Office has actively played its part in addressing the ongoing pandemic in the European region through virtual meetings, including one on schools, but also through working together on the ground in our partner countries in the region. We thank you and all your colleagues at the Regional Office for your dedication and efforts in addressing the COVID-19 pandemic. We appreciate your decision to initiate a process on tracking the response by the regional office, promising full transparency in the early days of the pandemic. We acknowledge the establishment of the Monti Commission and will remain attentive to its recommendations. The pandemic continues to have a significant impact on the health and well-being of our people, economies and societies. Ensuring health security in the face of emergencies and other threats to health was one of the key elements of your vision for the WHO European region. The European Programme of Work for 2020 to 2025, which we will discuss later today, will define the framework for our collaboration in the challenging times ahead. Thank you all for your work. All the best.
Thank you very much, Germany. I now give the floor to the delegate of Italy, to be followed by the delegate of Azerbaijan. Italy, you have the floor.
General, Regional Director, Dear Director General, Regional Director, fellow Minister and delegates. The annual meeting of the countries belonging to the WHO European region that has been the first after China and the East Asian countries to be affected by the pandemic is an important opportunity for us to reflect on the lessons learned and the current impacts of the COVID-19 crisis on our countries in Europe and in all the world. Only working together, we can win the challenge of such historic and global magnitude. Thus, I would like to thank Hans Klug for putting this issue high in our agenda. Despite the cultural, economic and social differences characterizing such a large area as the WHO European region, across which the COVID-19 pandemic has spread at different points in time and with different intensities, we need to focus on the elements that brings us together. Such massive global challenge can only be won if we put all together and learn one from each other in order to develop shared tools and strategies. I'm convinced that the words we have just heard from DG Tedros and Regional Director Klug will open the way to constructive discussion. We must work on the weaknesses that this crisis has exposed. We are now aware that catastrophic events, for years little more than theoretical models for testing our healthcare system response capacity, can indeed affect us dramatically in terms of health and resources. The WHO initiative to set up an independent panel for pandemic preparedness and response to evaluate the world's response to the COVID-19 pandemic in terms of assessment, choices, timelines, and communication is a key step to ensure accountability and to respond effectively and transparently to the question and criticism received. To fulfill our mandate to protect our fellow citizens' health, we must identify, implement, and enforce measures to contain the spread of the infection within a general framework of universal health coverage and access to treatment. All the initiatives we may take will be more effective if we implement them in a coordinated manner and in a framework of reciprocity. Instead of penalizing or blaming any country, our aim must be to help each other. I refer to the decisions on personal contacts, masks, social distancing, quarantine, travel restrictions when necessary, and to measures on our response capacity, like vaccines and effective medicines. On this front, a joint effort is already underway with Italy's strong involvement, based on the principle that treatment must be available for everyone as a public good, which must be offered without distinctions to all citizens in our countries and across the world. We have to do our best to share knowledge, as we are doing on school reopening security or in the Monti Commissions. We have to build together production capacity and support alliances that can help us to achieve these objectives for example, the ACT accelerator. With this approach, Italy confirms its strong partnership with WHO. In closing, I wish to thank WHO for the support given at global and regional level to our country during the difficult times we experienced last spring.
Thank you very much, Italy. I now give the floor to the delegate from Azerbaijan, to be followed by Turkey. Azerbaijan, you have the floor.
Глубоко уважаемый доктор Тедрос, глубоко уважаемый доктор Клюге, глубоко уважаемые коллеги, позвольте поздравить всех нас с юбилейной 70-й сессией Европейского регионального комитета ВОЗ и выразить слова благодарности всем тем, кто вложил немалый труд в создание и развитие этой организации. Думаю, что сейчас, когда у руля регионального комитета стоит человек с 25-летним опытом практической работы, доктор Ханс Клюге, мы сможем противостоять не одному глобальному вызову, стоящему на пути общественного здоровья и здравоохранения. Глубоко уважаемые коллеги, история с коронавирусом еще раз продемонстрировала всем нам, насколько мы все в этом мире взаимосвязаны и взаимозависимы. Беда объединила все страны мира в борьбе с эпидемией коронавируса, который принес с собой много боли и страданий. И наша страна тому не исключение. С момента выявления случаев заражения коронавирусом в Азербайджане был создан оперативный штаб при правительстве, который разработал четкую стратегию для предотвращения распространения инфекции в стране. В отличие от многих стран, где основная тяжесть лечения была возложена на стационарные учреждения, нами была задействована широкая сеть амбулаторно-поликлинических учреждений. Привлекло к работе значительное количество врачей и среднего персонала поликлиник. Это позволило, во-первых, выявлять болезнь уже на ранних стадиях, а также взять на контроль и обеспечить изоляцию всех контактных лиц и таким образом предупредить распространение инфекции. Всем выявленным пациентам была обеспечена бесплатная раздача пакета необходимых препаратов. Следует отметить, что лечение коронавируса в амбулаторных условиях дало очень хорошие результаты и позволило резко снизить показания для госпитализации. На сегодняшний день в больницы попадает не более 10% зараженных, как правило, из рисковых групп населения, а также при сопутствующих соматических заболеваниях. Большим подспорьем для нас явилось сотрудничество как с Центральным, так и с Европейским офисом ВОЗ, а также сотрудничество, обмен опытом с другими странами в рамках регионального и международных организаций. Сегодня борьба с коронавирусом находится под полным контролем правительства и уже осуществляется поэтапный выход из карантина. Несомненно, что все эти решительные меры были санкционированы четкой и дальновидной политикой президента Азербайджана господина Ильхама Алиева, по распоряжению которого в условиях мировой пандемии и экономической стагнации были предприняты беспрецедентные меры. При наличии в стране более 700 больниц в кратчайшие сроки были возведены и сданы в эксплуатацию 11 модульных больниц для этой категории больных. Задействовано 34 лаборатории для диагностики болезней, хотя в начале пандемии таких лабораторий было только 6. В связи с возросшим спросом на медицинские маски за короткий промежуток были открыты для предприятий, 2 предприятия по производству медицинских масок и дезинфицирующих средств. Учитывая социально-экономическое положение жителей страны в условиях карантина, были сохранены рабочие места и зарплаты работников на время карантина. Безработным правительство ежемесячно выплачивает социальные пособия. Оценивая самоотверженный труд медицинских работников в условиях пандемии, руководство страны приняло решение об увеличении зарплат медицинских работников в 3-5 раз. Что касается внешней политики, Азербайджан в очередной раз доказал свою приверженность гуманистическим принципам и в условиях пандемии коронавируса выделил $5 миллионов ВОЗ и еще $5 миллионов для стран-членов движения присоединения. Более того, Азербайджан оказал гуманитарную помощь в борьбе с коронавирусом более чем 30 странам мира. В целом, модель борьбы правительства Азербайджана с пандемией коронавируса можно назвать солидарностью с миром и ответственностью за каждого гражданина. Пандемия коронавируса еще раз напомнила всем нам о том, что в основе социальной, экономической, политической стабильности и развития общества лежат социальные детерминанты здоровья. Хорошее общественное здоровье является главной инвестицией в будущее. Благодарю вас за внимание.
Thank you very much, Azerbaijan. I now give the floor to the delegate of Turkey, to be followed by Israel. Turkey, you have the floor.
Teşekkürler Sayın Başkan, saygıdeğer Genel Direktör ve Bölge
Thank you, Mr. Chair, distinguished Director General and Regional Director, esteemed participants. I would like to begin my words by expressing my pleasure to be with all of you today, albeit in a virtual environment. There's a saying in Turkey, first comes health. This pandemic has bitterly showed how accurate this saying to the whole world. So far, we have been able to keep the pandemic in check in Turkey thanks to a resilient test, contact tracing, and treatment strategy. While doing so, we have been comforted to see that the mortality rate, including those of the elderly, has been steadily low. We have and will continue to protect the vulnerable elderly, those with comorbidities, and healthcare professionals to the best of our ability. The whole world is waiting in hope for progress on the COVID-19 vaccine. WHO has important tasks for both ensuring the safety and the fair distribution of this prospective vaccine. On every platform, we have underlined the importance of a strong WHO and how we advocate for it. In this process, we will also be pleased to see a proactive regional office that develops the best possible solutions for the needs of the region of Europe. Distinguished participants, what we need is solidarity and unity. Turkey has demonstrated the epitome of international solidarity by supporting more than 150 countries and international organizations with medical supplies. As a sign of our belief in a strong WHO and regional solidarity, last week together with the regional director, we have opened the WHO Istanbul office, which will serve for health emergencies. I would like to point out that $25 million donated by Turkey in these challenging times, during which most countries direct their resources to their national needs, stands out as a very important support to global health security. I hope that this office, which was also opened during a very critical time as we are fighting against COVID-19, will deliver concrete outcomes on a global scale. Distinguished Regional Director, I would like to thank you for the vision document you have presented. I am confident that your vision, leadership, and priorities will contribute to the improving the regional health status. In the vision, I see a strong emphasis placed on leaving no one behind. I'm quite glad that the migrant health program is going to continue with some new changes, because I would be happy to see migration and health to become a priority for the region of Europe, considering the huge burden Turkey is shouldering on these topics on behalf of Europe. Distinguished Regional Director, finally, bearing in mind the efforts of our brave healthcare workers, I second your proposal on extending the year of the nurse and the midwife into 2021. I even would like to suggest broadening the scope even further and designating 2021 as the year of the healthcare worker. Thank you.
Teşekkür ediyorum.
Thank you very much, Turkey. I now give the floor to the delegate of Israel, to be followed by the Russian Federation. Israel, you have the floor.
Dear Chairman, good morning. We are actually scheduled to speak at 12:35. My minister would leave the cabinet and address his talk at that time. So we would like the timetable that we were receiving this morning, please.
Thank you very much, Israel. It is noted, and we will get back to you and your minister at around 12:35. I now give the floor to the delegate from the Russian Federation, to be followed by Tajikistan. Russian Federation, you have the floor.
Уважаемый господин председатель и региональный директор, выражаю признательность генеральному директору и региональному директору за доклад. Благодарим также Ханса Клюге за эффективную координацию усилий по борьбе с новой коронавирусной инфекцией в европейском регионе. Пандемия COVID-19 стала серьезным испытанием для систем здравоохранения и показала, что международная взаимопомощь и обмен лучшими практиками являются фундаментом эффективной системы здравоохранения и реагирования на угрозу разных стран. И сегодня многие страны говорят о помощи своим соседям, и это самый главный большой опыт этого периода, последнего полугодия. Российская Федерация обладает уникальным опытом эффективного противодействия и оказывает весомую финансовую экспертную поддержку Всемирной организации здравоохранения и другим странам в борьбе с пандемией. Пандемия также выявила проблемы в регулярности и полноте осуществления определенных лечебных и профилактических мероприятий. Важно сохранить достигнутый в европейском регионе прогресс в области профилактики и борьбы с неинфекционными заболеваниями. Акцентировать свою помощь медицинскую мы должны не только на борьбе с COVID-19, но и не забывать о всех остальных пациентах, нуждающихся в медицинской помощи. Уважаемый господин председатель, отмечаем важность выполнения резолюции 73-й сессии Всемирной ассамблеи здравоохранения, которая поручила генеральному директору ВОЗ при участии государств инициировать процесс оценки международных мер реагирования на COVID-19. С сожалением констатируем, что ряд ключевых решений по выполнению резолюции принимались руководством ВОЗ без надлежащего учета мнений стран-членов. Мы разочарованы нетранспарентностью процесса формирования независимой комиссии по оценке готовности к пандемии и эффективности ответных мер. Особая просьба. Мы хотели бы попросить, чтобы Российская Федерация активно была подключена к процессу обсуждения. На этом свое выступление закончим. Спасибо большое.
Thank you very much, Russian Federation. And I'll give the floor to the delegate of Tajikistan, to be followed by Malta. Tajikistan, you have the floor.
Уважаемый господин председатель, уважаемый господин региональный директор Ханс Клюге, уважаемые участники 70-й сессии Европейского регионального комитета Всемирной организации здравоохранения. Сегодня происходит для всех нас очень важный исторический момент, когда сессия региональный комитет впервые проводится в виртуальном формате для всех стран-участников в связи с пандемией COVID-19. Мы все стоим единым фронтом и всем миром ищем пути решения для предотвращения распространения COVID-19. Каждая страна почувствовала тяжелое время этой болезни и проходит через тяжелое время испытаний. Спасибо врачам и медсестрам всего мира за героический подвиг и неоценимый труд в тяжелых условиях пандемии. Таджикистан также оказался перед лицом данной угрозы, и мы счастливы, что мы не одиноки в нашей борьбе. Правильная и своевременная помощь Всемирной организации здравоохранения в условиях пандемии очень важна, особенно для Таджикистана, как стране с развивающейся системой здравоохранения. Полученный нами опыт позволит обратить пристальное внимание на те области, которые требуют срочные решения, и на те проблемы, которые должны решаться в долгосрочном плане. Как вы знаете, в мае этого года Всемирная организация здравоохранения оказала техническую поддержку и отправила в Таджикистан миссию, которая в кратчайшие сроки смогли подготовить рекомендации по предотвращению COVID-19 в стране. Правительство Таджикистана обратилось в ВОЗу с просьбой о технической помощи, и считанные дни Всемирная организация здравоохранения смог мобилизовать свои лучшие ресурсы и обеспечить запрошенную техническую помощь посредством активации ГУАРМ. По сей день Таджикистан получает ежедневную помощь, консультанты и сотрудники Всемирной организации здравоохранения совместно работают по всей стране. Значительные результаты совместной работы в области диагностики и лечения, а также инфекционного контроля радуют меня как руководителя системы здравоохранения и как гражданина Таджикистана, так как все эти усилия направлены на достижение здоровья нашего населения. Мы, как органы здравоохранения, должны обеспечить всеобщий доступ нашего населения к качественной помощи без риска обнищания, обеспечить эффективную защиту при чрезвычайных ситуациях в области здравоохранения и обеспечить возможность для развития здорового общества, в котором действие общественного здравоохранения и разумная государственная политика будут способствовать улучшению условий жизни на основе экономики благополучия. Все эти аспекты озвучены в новой европейской программе работе на 2020-2025 год, совместные действия для улучшения здоровья и разработанный план действия помогут нам достигнуть наших совместных целей. Мы, как страна-участник Всемирной организации здравоохранения, привержены воплощению в жизнь глобального перспективного видения, сформулированного в 13-й общей программе работы ВОЗа 2019-2023 год. Мы нацелены на достижение цели 3 миллиардов и выполнение своих обязательств по реализации действия в области устойчивого развития на период до 2030 годов ради обеспечения здоровой жизни и благополучия для всех людей. Общими усилиями будем выполнять эти задачи в своей стране при помощи Европейского регионального бюро ВОЗа, партнеров и гражданского сообщества. Уверен, что в течение 2 дней мы достигнем соглашения и будем готовы и далее совместно самоотверженно работать ради здоровья человечества и добьемся здоровья для всех. Разрешите мне повторить слова великого персидского врача и ученого Авиценны Ибн Сина, который также призывал к единению. В одиночестве человек не выжил бы. Все то, в чем он нуждается, он получает лишь благодаря обществу. Здоровье сохранят, задача медицины, болезни суд, понять и устранить причины. Давайте будем единым обществом и вместе достигнем наших целей. Спасибо за внимание.
Thank you very much, Tajikistan. I now give the floor to Malta to be followed by the delegate of Belgium. Malta, you have the floor.
Thank you very much, Mr. President, Director General, Regional Director. Malta aligns itself with the statement delivered by Germany on behalf of the European Union and its member states. Mr. President, yes, COVID-19 has taken up over the last 8-9 months much of our focus, much of our energy, and much of our resources. And it is right and fitting that we continue to pay great attention to the outcomes of this pandemic and to what is going on, and to continue to learn from each other and from the processes that have been occurring over the last few months. And I think the key word here is learn rather than point fingers at each other, because it is obvious now that the more we work together, the more we coordinate, the better the outcomes for all of our citizens. And this element of solidarity now needs to come into practice when eventually the coronavirus, the COVID vaccine is available, to make sure that it is not only available on the international markets, but that it is actually available to our citizens according to the needs in different regions, in different areas throughout the European region. Similarly, now we have an opportunity to extend the lessons that we have and that we are continuing to learn from the coronavirus pandemic, and to channel the increased awareness and public interest in public health measures that have evolved over the last few months because of the coronavirus pandemic onto the influenza epidemic that we have every year. I think we have an opportunity to make sure that the public health measures that have been so readily accepted for coronavirus are similarly now pushed for the influenza epidemic. After all, it is possible that the influenza leads to more mortality and morbidity, or at least as much mortality and morbidity as the coronavirus has caused over the last few months. But having said all this, and of course it is fitting that we continue to look at the pandemic as one of the major public health threats, we have to remember that there are other non-COVID areas that we need to focus on. One of which is the treatment and the care of cancer patients. Unfortunately, during these last few months, in several of our centers, cancer care has, to a certain extent, taken a bit of a back burner position because we have channeled our resources to COVID. We need to continue to focus on joint efforts to tackle cancer, especially when it comes to the access of new, innovative, and highly expensive medicines. Our push towards price transparency needs to continue, and I am glad that WHO are also, and specifically WHO Europe, are also keeping this on the front burner over the next few months. Similarly, the issue of antimicrobial resistance needs to continue to be on the forefront of our agenda, and we need to continue to press this because as we are spending a lot of our time and a lot of our energy and a lot of our resources combating, and rightly so, the COVID pandemic, we mustn't forget the other major issues, and AMR is certainly one of them. So, Regional Director, once again, I thank you for your leadership in these difficult times, and Malta, of course, welcomes the European Programme of Works for 2025, which we will be discussing later. And I also extend my congratulations to Professor Monti, and of course, Malta will be very willing to collaborate with the work of the Commission. Thank you once again.
Thank you very much, Malta. And I'll give the floor to the delegate from Belgium to be followed by Austria. Belgium, you have the floor.
Thank you very much, Director General, Regional Director, and colleagues, Ministers of Health. Belgium aligns itself with the statement made by Germany on behalf of the European Union and its member states. So Belgium would like to thank you, Director General, and your team for your work in the ongoing health crisis. The WHO's role in supporting countries has been and remains crucial in this crisis. We look also forward to the outcome of the independent panel for pandemic preparedness and response, and we hope that this evaluation can be conducted in full independency and in a serene atmosphere. To the Regional Director, which is a country fellowman, dear Hans, we congratulate you with your first month in office. This was certainly not the most obvious way to start your mandate as a Regional Director. But we thank you and your team for your achievements, the rapid reactions, repurposing, as you call it, to respond to the pandemic. So let me address 3 points. Firstly, I seize the occasion to draw attention to the Belgian National Strategic Plan to tackle the future of this crisis. The plan is built on 2 pillars: prevention and management of new infections and clusters in the first pillar, and the health system's capacity to react and resist in the second pillar. This plan might also inform a future pan-European action plan to coordinate action against new waves of COVID-19 or other pandemics. Secondly, this crisis has taught us what public health, social well-being, and economy have to work hand in hand. We are looking forward to the work of the Pan-European Commission on Health and Sustainable Development. Nevertheless, we urge caution to avoid overlap or interference with the EPPR's work. Finally, the current pandemic may not let us forget the other manifold public health challenges to tackle. The European Programme of Work, including its different flagships, is very helpful in this perspective. We are also looking forward to the high-level panel on pharmaceutical pricing to be organized in Oslo in the beginning of March 2021. Thank you for your attention.
Thank you very much, Belgium. And before I give the floor to Austria, we will now take a very small, short, healthy break. We have a long agenda ahead of us, and we all need to keep energized mentally as well as physically, and we need to get the circulation going. So we have now invited Johanny Reyes, who's the fitness manager here in the UN city in Copenhagen, and he will now guide us through some very simple physical exercises. So all of us here in the room in Copenhagen, we are of course joining into the physical exercise together with Johanny, but I also urge all of you participating virtually from your capitals to join us in the physical exercise. Please, Johanny, you have the floor.
Thank you very much, and good morning to all. Delighted to be here with this elite group of people with mission to make the world a healthier place and make the world a healthiest place. Right, so why don't we start doing a little bit of stretches, simple exercises that we potentially release some of the tensions accumulated on those areas, neck, shoulders, upper back, and hips, that are often produced by prolonged sitting and poor posture. Right, with that end, so now if you can guide me through it, all right, and placing yourself in a straight position and chest is forward, right? Neck is back, and release your neck all the way back. Stretching your neck muscles as the chest pulls forward. Then you use the strength of your arms to push yourself back, arms a little bit fat. As the chest moves forward, opening up the rib cage. Deep inhale, long exhale. And from that position, deep inhale and long exhale. Ladies and gentlemen, can you kindly place your arms right in front of your shoulders, fully extended, and just make a little bit circular motions as you maintain a nice straight posture. You want your nose and your face to be above the horizon. All right? Why do we do that? To put less pressure on the neck. All righty? As we bring that neck forward. Alrighty, we're putting pressure on the neck, shoulders. By bringing it back, we're releasing some of that tension. Now, can we rotate in the opposite direction, please? Excellent, here we go. Deep inhale, long exhale, 4, 3, 2. We switch the motion to the side, and that's going to stimulate some of your shoulders and neck muscles. As we continue with the long, prolonged inhale, long exhale. Okay, both physically and mentally, telling yourself to relax. You've been sitting for a few hours already. All righty, now it's time for us to take a little pause, concentrate on increasing the amount of oxygen, getting some mobility, increasing the blood flow in there so we can continue doing this wonderful job that we're doing. 4, 3, 2, 1. Arms come back, and now can you guide me through it? Can we engage a little bit of the hips and lower back? Of course we can. And as we go down, arms comes down. Back up. What are we aiming to do here? We're aiming to releasing some of the tension on the hips, lower back, by sitting for so many hours. Ladies and gentlemen, only a few more. We're almost there. Alrighty, I am dying in here, guys. My muscles are dying. There's too much exercise in here. It's been 3 hours exercising with you. 2 more. I need 1 more. Last one here. And ladies and gentlemen, please place your hands on top of your knees and just rotate. This is a different movement, aiming at the same, releasing some of the tension, increasing the blood flow. 1, 2, and 3. Can we just shift the direction? 5, 4, 3, 2, and ladies and gentlemen, come out to a straight position. Thank you so much. I look forward to abuse you again in the afternoon. Keep you moving.
Thank you very much, Johanny. I need a sip of water after that. That was very energizing. Thank you very much. And we'll certainly bring back Johanny later in the afternoon. As I said, we have a long agenda ahead of us. So I urge all delegates to please restrict their interventions to be concise and within the allotted time limit. I now give the floor to Austria, to be followed by Turkmenistan. Austria, you have the floor.
Thank you, President. Thank you, big brother Tedros, and also big brother Hans. Austria aligns itself with the statement of the European Union and its member states. The first phase of the WHO Regional Director Hans Kluge's term of office was remarkable, especially in view of the COVID-19 pandemic being a major and unexpected challenge for all of us. Praise and thanks to WHO Regional Director Kluge and his team for the inclusive process, transparent information sharing, and excellent communication with member states during this health crisis. This also reflects in your first report to the regional committee, first time ever, clear language, transparent facts, and a clear picture where we stay. WHO Euro Regional Office under your leadership, Hans, has done an excellent job and delivered already a best practice example in crisis management. We appreciate that in many respects as relevant to the global level in the context of the inter-organizational transformation processes and the reform of WHO. Dear colleagues and friends, we all have to move forward in this time of crisis. It is the largest health crisis and also the largest socioeconomic crisis, at least in my lifetime. And we have to move from crisis management to managing the virus. For example, to prepare ourselves when COVID meets influenza, or when it comes to securing availability and equal access to vaccines against COVID. We have to come up with practical measures in our daily lives because we can't no longer close schools, shut down our economies, cultural and social lives, and so on. But I also have to say candidly and clearly that on the global level, WHO has to learn from the Euro region when it comes to transparency and inclusiveness in the decision-making processes. Just to mention it one more time, the last time probably, but one more time, WHO's executive board has not convened once since February on the issue of COVID-19. There was no structured, open and transparent consultation with member states. There was given good information, precise information, nothing to criticize. There was good scientific advice, but not proper consultation how we can overcome this dilemma which we are all in with appropriate policy measures. And this consultation would have been crucial when it comes, and I give you some examples, when it comes to commonly shared global travel regimes to minimize the impact millions of businesses, travelers and tourists have to bear with. Or we should have come up much earlier, and this is a crucial thing, with a shared understanding for epidemic data, because the fixation on the sheer numbers does not reflect the reality of our daily life on the ground, especially when we have to, and we have learned to make a distinction between age groups, symptomatic, asymptomatic infections, etc., etc. Or another very important point, what does it really mean when we talk about global public good when it comes to vaccines? In the moment, at least in my interpretation, this is quite an empty shell. These and many, many other issues haven't been properly consulted on between member states and the Secretariat. And when it comes to the setting up of the IPPR, the evolution of the pandemic crisis in general, there has been no consultation at all. In fact, we now have to overcome quickly this situation. Otherwise, the whole process is endangered of losing its credibility. To be also frank and open, the members of the executive board from the Euro region were always
Thank you very much. Austria, can I ask you to please wrap up your intervention?
Yes, I'm wrapping up, but you know, this is also a part of the consultation process between the member states and the said different levels of Secretariat. So the point I would like to make is that eventually now we have a special meeting of the executive board, and I'm looking forward. You know, the past is history, and we have to be better in this member states consultation. And Hans, be reassured, this has nothing to do with you, because you are an example of transparency and inclusiveness and proper consultation. But I'm looking forward to overcome this situation, and that we are getting also to better governing structures within WHO, and that also is important to set the next step.
Thank you very much, Austria. Thank you very much, Austria. Once again, I would like to urge the delegates to limit their interventions in the interest of time. We have a long agenda ahead of us. Thank you very much. I now give the floor to Turkmenistan, to be followed by the United Kingdom. Turkmenistan, you have the floor.
Уважаемый председатель, к сожалению, министр не может прийти, поэтому он сейчас занят на собрании кабинета министра, поэтому выступаю я, заместитель министра. Уважаемый участник 70-й сессии Европейский региональный комитет Всемирной организации здравоохранения. Дамы и господа, прежде всего, позвольте выразить благодарность Европейскому региональному бюро Всемирной организации здравоохранения за организацию регионального комитета. Также трудно для всех время. Мы рады встретиться с государственными членами и обменяться опытом. Туркменистан поддерживает отчет регионального директора Всемирной организации здравоохранения доктора Ханс Клюге. В особенности усилия направлены на борьбу с COVID-19. Мы также поддерживаем европейскую программу, разработанную Европейским региональным бюро Всемирной организации здравоохранения, в которой усиливается четкую дорожную карту для следующих 4 этапов, обозначенных флагманскими инициативами, такими как анализ поведенческих факторов, психическое здоровье, цифровое здравоохранение и иммунизация, а также внимание, которое уделяется всеобщему охвату здравоохранения. Всеобщий охват услугам здравоохранения является главным приоритетом для правительства Туркменистана. Мы понимаем, что система здравоохранения должна быть ориентирована на потребности людей, учитывать социальную справедливость и, конечно, финансовую защиту населения. Все люди должны иметь доступ к необходимым медицинским услугам, включая профилактику, качественное лечение и подлежащую реабилитацию. Фундаментом всех систем здравоохранения является первичное звено, на которое уделяется большое внимание и усилия в стране, способствующий фактор для развития первичной медико-санитарной помощи в Туркменистане. Конечно же, является сильной приверженностью правительства делу здравоохранения. Сильная законодательная база, поддержка со стороны международной организации и инвестирование и здравоохранение, в том числе в первичную медико-санитарную помощь. Эти усилия помогли улучшить показатели здоровья населения и повысить уровень социальной справедливости и эффективность системы здравоохранения, о чем свидетельствуют полученные результаты проведенных исследований. Как известно, на сегодняшний день борьба с COVID-19 остается одним из главных вопросов мировой повестки дня. В этом связи хотелось бы отметить, что Туркменистан полномерно внедряет профилактические меры по предотвращению и контролю инфекций. На правительственном уровне были приняты национальный план обеспечения готовности к противодействию и реагированию стран на острые инфекционные заболевания и национальный план оперативных социально-экономических мероприятий в Туркменистане по противодействию пандемии коронавируса. Мы поддерживаем лидерство Всемирной организации здравоохранения в роли борьбы с пандемией. Ценим прямую поддержку Всемирной организации здравоохранения путем направления миссии Всемирной организации здравоохранения по обеспечению готовности к COVID-19 и ответным мерам в стране. И мы выполняем все рекомендации Всемирной организации здравоохранения, разработаны по результатам миссии. Мы также готовы принять вторую миссию Всемирной организации здравоохранения в Туркменистане лабораторным вопросам. В заключение хочу поблагодарить Европейскую Всемирную организацию здравоохранения за огромный вклад в здоровье всего человечества и пожелать успехов, улучшения здоровья и повышения благосостояния нынешнего и грядущих поколений. Благодарю за внимание.
Thank you very much, Turkmenistan. I now give the floor to the United Kingdom to be followed by Albania. United Kingdom, you have the floor.
Thank you, and thank you to the Director General and Regional Director for your addresses. The UK continues to greatly value WHO and the crucial leadership role it plays at a difficult time. This pandemic has hit the poorest hardest, and as we strive to address the disparity in outcomes within our own countries, we also remain acutely aware and concerned by the inequalities we see in the global situation. As member states have made difficult decisions, balancing the trade-offs between the economic, societal, humanitarian and public health impacts, it is clear this is not a virus that will be defeated by a siloed response. WHO cannot act in isolation, and the importance of a strong and visible WHO within the wider international system has never been clearer. We are also reminded during this regional committee that the plethora of global issues which we usually discuss in great depth here do not stop in the midst of a pandemic. I know that WHO and DG Tedros also face considerable decisions and trade-offs and continue to work tirelessly to tackle these issues as well, not least the latest outbreak of Ebola in the DRC. And we ask that you lead by example in ensuring that during the vital pandemic response, we do not lose sight of the importance of maintaining other health services and avoiding more damage to non-COVID health outcomes. The indirect effects on other health conditions from this pandemic is likely to be severe. Hans, none of us could have foreseen the challenge of your first year in office would bring, and we would like to thank you for your leadership whilst you have shaped the regional office to be agile enough to respond to a crisis which hit us as a continent early and hard, and demonstrated that not only do we share borders, we also have lessons to share and learn as well. Working together to ensure our national and international responses are grounded solidly in the best scientific evidence will continue to be crucial. The UK places a great value in research and development and is pleased to contribute to the shared evidence base, most notably through the recovery clinical trials, which have contributed to the WHO-approved recommendations on the use of dexamethasone and the avoidance of hydroxychloroquine to reduce mortality in severe cases. It has been helpful to engage with you and colleagues in other member states of the region to share learning and experiences across a wide range of new public health policies and initiatives, population-wide testing, contact tracing, and local lockdowns as examples. And we thank the regional office for the guidance and opportunities to engage that you have provided. As we move to the next stage of the pandemic, we remain committed to continuing our work with partners across the globe, particularly our friends in this region and regional office, to tackle the virus and its wider health effects. And we look forward to contributing on subsequent items during this regional committee, where we will look forward to the future on the EPW, transformation, and how we can work together to ensure this pandemic does not set us back in the health battles we've been fighting for so long. Thank you very much.
Thank you very much, United Kingdom. I now give the floor to the delegate from Albania to be followed by Kazakhstan. Albania, you have the floor.
Thank you, President of the session, Director General, Honorable Regional Director. Allow me to thank Dr. Kluge for presenting a report that encompasses the work in these challenging times. This is truly the year of the heroes in white. People have rediscovered the true nature of healthcare. Countries need to rethink the human resource policy in health. No district, no town, no village should be left behind. This is our motto in Albania, and we endorse the proposal for extending the Year of Nurse and Midwife campaign to 2021. We would like to thank WHO and its country office for the daily support that has provided, and commend WHO regional office for supporting countries over the years with the influenza surveillance and response system. Albania undertook a careful analysis since the very beginning, being aware and realistic about the capacities of the health system and people's behavior. The government of Albania took the right decision to lock down the country during March and April 2020. Lives were saved, the health system didn't collapse. Starting from the beginning of May, strategies were developed and pursued to balance between controlling the SARS-CoV-2 epidemic and optimizing measures to minimize their costs and side effects. WHO technical support and guidance has helped shape 3 sequential countries' COVID preparedness and response plans: COVID-19 Action Plan of Albania, Prevention, Preparedness and Response Against COVID-19 in March 2020, COVID Reopening Strategy of Albania in April 2020, and strategy for the adaptation of the health system for the dual-track response to COVID-19 in the period of autumn and winter 2021, when influenza and influenza-like illnesses will be at their peak. As part of the international solidarity and collaboration, Albania is already part in the solidarity trial. The government of Albania has also confirmed the interest part of its facility. Let me also underline the need to further build back better with 5 priorities as the vision of the Sustainable Development Agenda. These can only be achieved if we address gender, equity and human rights, environmental transformation, and the scaling up of our health and services. No one should be left behind. Albania appreciates the swift and clear action of the regional director for renewing and strengthening the partnership with the Commission. This is particularly relevant to Albania as the US session discussion will start very soon and is a strategic priority for the country. Thank you for your attention.
Thank you very much, Albania. I now give the floor to the delegate of Kazakhstan, to be followed by Romania. Kazakhstan, you have the floor.
Distinguished Executive President, Director General Dr. Tedros Ghebreyesus, Regional Director Dr. Hans Kluge, Honorable Ministers, Ambassadors, participants of the 70th session of the Regional Committee for Europe. It is my great pleasure to address you at the 70th session of the Regional Committee for Europe. This year, Regional Committee is being held in an unusual virtual format. The coronavirus pandemic has become a test of the unity and strength of collaboration between countries within the framework of international organizations. It's demonstrated the key importance of international cooperation, interaction, and joint efforts of states in the fight against infection. I would like to express our gratitude to the World Health Organization, its Director General, Dr. Tedros, and Regional Director, Dr. Hans Kluge, for their leading role in combating COVID-19 globally. We thank WHO for all technical guidances in preparedness, readiness, and response actions for COVID-19, risk communication, community engagement, and other critical topics. Kazakhstan has taken tremendous efforts to contain the spread of COVID-19, and now we are focusing on transition by mitigating restriction measures. At the same time, we are taking actions to robust the health system for the possible second wave by integrating primary health care into overall public health response to COVID. The role of primary health care is crucial in informing patients and community, interrupting the chain of transmission, and identifying vulnerable population groups, as well as ensuring appropriate referral for testing, home isolation, and hospital admission. The other important issue is a broader use of digital technologies and development of a digital health ecosystem, which provide us new possibilities during the challenging time of the COVID-19 pandemic. Digitalization of the public health surveillance laboratories and public health, primary health care has been played an important role in Kazakhstan to take timely response and right actions. On the last session of the WHO Executive Board, Kazakhstan initiated a decision on primary healthcare to adopt the operational framework on primary healthcare that was supported by all member states. Once again, I want to highlight the importance of strengthening primary healthcare, which is playing a major role in eradication of current pandemic and prevention of other infection diseases. We need to stay on track of the principle of universal health coverage and basic role of primary healthcare. The Ministry of Health of the Republic of Kazakhstan fully supports the development and adoption of the Global Action Plan for Patient Safety, as well as WHO's proposal to declare September 17th as the annual World Patient Safety Day. Dear colleagues, participants of the 70th session of the Regional Committee for Europe, we express our highest appreciation and support to the dedication, efforts, and sacrifices to all health professionals, health workers, and other relevant frontline workers. Only together we can win. Thank you, and I wish us productive and efficient work within 2 days of the Regional Committee. Thank you.
Thank you very much, Kazakhstan. And I'll give the floor to Romania, to be followed by Lithuania. Delegate of Romania, you have the floor. Romania, sorry, I think you have to unmute, or do we have to unmute? Please go ahead, Romania. Excuse me, Delegate from Romania, you need to unmute at your end, please. You need to unmute. We do not have sound from Romania.
Do you hear me now?
Yes, now it's perfect. Thank you. Go ahead, please.
Great, thank you. Your Excellencies, Director General, Regional Director, Honorable Ministers, ladies and gentlemen. I have the honor to deliver this statement on behalf of the member states of the Southeastern Europe Health Network and its member states. The COVID-19 pandemic has placed a heavy toll on our health systems, on our economies, and our livelihoods. It has also shown that the low and middle income countries have the most vulnerable in this unequal fight. The member states of the network, individually and in joint alliance, have dedicated tremendous efforts to contain the spread of the virus in line with the WHO guidelines and recommendations. Following the outbreak of the COVID-19 pandemic, the network governments introduced containment measurements around the mid-March. Many states of the network governments declared national state of emergency and implemented a number of measurements promoting self-isolation. These also included border closures, travel restrictions, and lockdown procedures, as well as a new set of monetary and fiscal policy measurements. The COVID-19 outbreak has posed a major challenge to the fragile health system in the CEE region, which have been chronically suffering from low health expenditures. Relaxation measurements were progressively introduced since the end of May 2020 to stimulate the opening of economies and societies of the region, keeping the strict hygiene and physical distancing measurements. As of 5th of December 2020, a total of 365 confirmed cases and 8,971 deaths have been reported in the CEE region. Many countries in the region are now experiencing a new surge of COVID-19 morbidity and mortality, indicating that the battle is not over yet. Continuous vigilance and country-specific strategies will have to be maintained, taking into account the additional burden of the healthcare systems posed by the upcoming seasonal influenza. The COVID-19 battle reminds us of the paramount importance of the essential public health functions. Primary healthcare, one of the key drivers in this pursuit, according to the principles of the Declaration of Alma-Ata and Astana, has been subject of special attention in the CEE region during this last couple of years. From 2017 to 2019, the network states, together with the WHO and partners, carried out several workshops on NIHC that focused on analysis of the primary healthcare systems in the CE region. Furthermore, this network, in partnership with Central European Initiatives, is implementing a project strengthening capacities of nurses, frontline healthcare workers during the COVID-19 response, with the overall objective to contribute to a better COVID-19 response and at the same time to concentrate on strengthening the capacities of the primary healthcare nurses in the network member states. And while have to mobilize all our resources to fight the virus at home, we also need to look beyond our borders to act in solidarity, since until everyone is safe and no one is in danger. This outbreak is a test for the regional and global emergency response mechanisms. Real-time exchange of information and coordination of measurements are essential for an effective and coherent response. I am pleased to acknowledge WHO Regional Office for Europe constant support provided to the member states to prevent, detect, and respond to the pandemic, coordinating the global and regional effort and demonstrating leadership in this time of crisis. I would like to further call on our partners, WHO, the Regional WHO Office for Europe, the European Commission, and all the other United Nations agencies to continue the initiatives and to ensure an equitable access to safe and affordable medicines and vaccines against COVID-19, with special focus on the most vulnerable countries and people most at risk. Thank you so much.
Thank you very much, Romania. I'll now give the floor to the delegate from Lithuania, to be followed by Bosnia and Herzegovina. Lithuania, you have the floor.
Excellencies, colleagues, Lithuania fully aligns itself with the statement on behalf of EU and its member states. Lithuania would like to thank the Director General and the Regional Director for Europe for their addresses and reports presented and express the appreciation for the work carried out so far by the World Health Organization and the Regional Office for Europe. We note with gratitude the continuous support and guidance provided to the countries in their fight with COVID-19. Yet the fight is not over, and the pandemic is still with us. It hit us with the most severe consequences, affecting not only the health sector, but all the aspects of our everyday life. While fighting it, we learned a lot, but still a lot is to be learned. Therefore, we believe that the start of the independent evaluation process of the COVID-19 response is very timely. It will help us to better understand what was done right and where improvements is needed. As we are learning how to live in this new reality, global efforts and leadership is crucial. The threat of COVID-19 knows no borders and is affecting all the spheres of our lives. Effective collaboration and the sense of solidarity must be maintained and enhanced. No one is safe until everyone is safe. The pandemic clearly showed us that we must adhere to the underlying principles of leaving no one behind and carry out the necessary reforms to make our health systems more resilient, robust and responsive. Health security and emergency preparedness are to be ensured. The implementation of the IHR globally is crucial. Lithuania remains committed to working together with the WHO in these challenging times. Thank you.
Thank you very much, Lithuania. And I'll give the floor to the delegate from Bosnia and Herzegovina, to be followed by Norway. Bosnia and Herzegovina, you have the floor.
Thank you very much. Due to the deteriorating health of Minister Gudeljevic, let me read you the speech on behalf of Minister Ankica Gudeljevic. Your Excellency, Dr. Tedros, dear Dr. Kluge, distinguished representatives of the member states of the World Health Organization in the region of Europe. It's a great honor and pleasure for me to address you on behalf of Council of Ministries the health authorities of Bosnia and Herzegovina, and my own behalf. COVID lasts and will last for a long time to come. Our task is to fight and try to be ahead of the virus in order to help people in Bosnia and Herzegovina. We are aware that testing needs to be intensified, that a much larger number of residents need to be involved. It needs to be a step ahead of the virus. The competent institution must find a mechanism to predict what will be and what the movement of the virus will be in order to be able to create different scenarios for the fight against the virus. We are aware that Bosnia and Herzegovina needs to strengthen contact tracing, which in Bosnia and Herzegovina is mainly based on the one contact with which the infected person was, while in other countries it is about monitoring 5 to 15 contacts. With the help and cooperation of the World Health Organization in BiH, we will make additional efforts to achieve these improvements. On this occasion, I would like to emphasize that the European program of work in the United Action for Better Health in Europe is also a commitment of Bosnia and Herzegovina. This program reminds us all again to strengthen our cooperation, our partnership, and our commitments. The goal of all of us is to build a healthier environment, and we can only achieve this through joint efforts. In cooperation with the regional office of the World Health Organization, I firmly believe that we can take a very important step in the following aspects. A strong healthcare system that includes all people who need healthcare, healthy living for all generations, protection of people in emergency conditions, strengthening the psychosocial aspects of life for every inhabitant of Bosnia and Herzegovina. And in that way, contribute to the realization of the Agenda 2030 in healthcare and an even stronger relationship with the World Health Organization. The desire for health is half of the health. And Bosnia and Herzegovina and the ministry, I have a desire, and I'm convinced that we will emerge victorious in the fight against the coronavirus disease, which I wish to all of you. Now, I would like to introduce two more members of Bosnia and Herzegovina delegation, Mr. Alen Šeranić, Minister of Health in Republika Srpska, and Goran Čerkes, Deputy Minister of Health in Federation Bosnia and Herzegovina. My colleagues will participate in the further work of Assembly. Thank you for your attention on behalf of Bosnia and Herzegovina delegation.
Thank you very much to Bosnia and Herzegovina. I now give the floor to Norway, to be followed by Israel. Norway, you have the floor.
Thank you, Chair. Director General, Regional Director, and dear colleagues. While this virtual format can never replace meeting you in person, I'm nonetheless grateful that we're able to meet under these circumstances. Dr. Tedros and Dr. Kluge, thank you for your leadership in the ongoing pandemic. And thanks to all the staff of the World Health Organization, stepping forward and taking the global lead and assisting countries in combating the virus and spare lives. The world needs a strong and effective World Health Organization and a constructive international collaboration more than ever. You both have our full support. Dr. Kluge, we appreciate the regional office's engagement in the Oslo conference, following up the World Health Assembly resolution on transparency in pharmaceutical market, which is planned for March next year. There are encouraging signs during this pandemic that the pharmaceutical industry is engaged in securing vaccines for all against the COVID-19, and the Oslo conference will build on this experience. Crises represent opportunities to learn and to be better prepared the next time. We will look forward to the recommendations from the independent panel and the International Health Regulation Review Committee. Evaluations will describe successful and less successful steps taken, both by the World Health Organization and by the countries. I agree with Dr. Tedros' ambition to meet these reports with humility and the willingness to change to strengthen the World Health Organization's ability to lead in crisis and improve the functioning of the international health regulation. We also recognize the need to make use of the present window of opportunity to discuss constructive reform ideas with a more immediate impact. COVID-19 will be affecting us for the foreseeable future. Norway is therefore honored to co-chair the ACT-A Facilitation Council to enable global equitable access to vaccines, therapeutics, and diagnostics, and to strengthen health systems. We urge all countries to contribute through COVAX to secure vaccines for all. Colleagues, in the wake of COVID-19, we should recall how crises exacerbate existing inequalities. We have also seen how health can determine not only our ability to live our lives freely, but also our basic security. This pandemic should strengthen our motivation to achieve universal health coverage as quickly as possible. Universal health coverage is both an equity agenda, a health agenda, and a security agenda. Thank you.
Thank you very much, Norway. I now give the floor to the delegate of Israel, to be followed by the Republic of Moldova. Israel, you have the floor.
I'm still waiting for my minister. Would you mind to switch me one page? Sorry.
No problem. I will now give the floor to the Republic of Moldova, to be followed by Latvia, and then we'll get back to Israel. So, Republic of Moldova, you have the floor.
Уважаемый господин генеральный директор, уважаемый господин региональный директор, уважаемые члены делегации, дамы и господа. Позвольте мне от имени правительства Республики Молдова поблагодарить вас, господин генеральный директор и господин региональный директор, за всю поддержку, оказанную Всемирной организацией здравоохранения, системе здравоохранения Республики Молдова в вопросах реагирования на пандемию COVID-19 и ее контроля. Всемирная организация здравоохранения предоставила Республике Молдова существенную техническую, медицинскую помощь, средства индивидуальной защиты и медицинское оборудование, а также оказала поддержку в вопросах человеческого капитала, информационного взаимодействия и информационных материалов. Правительство Республики Молдова в соответствии с руководством Всемирной организации здравоохранения приняло все рекомендованные меры в мобилизации национальных механизмов реагирования и угрозы в сфере общественного здоровья, вызванные пандемией COVID-19. В частности, Национальная чрезвычайная комиссия по общественному здоровью, исходя из эпидемиологической ситуации по состоянию на 24 февраля 2020 года, объявила желтый код тревоги в общественном здравоохранении. 8 марта — красный код. 15 мая было объявлено чрезвычайное положение в сфере общественного здравоохранения на всей территории Республики Молдова, которое в настоящий момент было продлено до 30 сентября 2020 года.
Thank you very much, Republic of Moldova. I now give the floor to Latvia, to be followed by Israel.
Latvia.
Mr. Executive
Director, can I please ask the floor again? We didn't finish our statement.
Sorry, I'm sorry, that's a mistake at my end. So please, Republic of Moldova, you have the floor.
Thank you very much.
Хочу также отметить, что все наши усилия с начала пандемии были направлены на обеспечение всех медицинских учреждений средствами защиты, на реорганизацию медицинских учреждений и обучение медицинских работников для обеспечения контроля инфекции COVID-19 и предоставления медицинских услуг пациентам, у которых был выявлен COVID-19, а также на информирование граждан о мерах защиты и опасности инфекции COVID для здоровья населения. В этом ключе при поддержке Всемирной организации здравоохранения был разработан национальный план подготовки и реагирования на инфекции коронавируса нового типа, который периодически обновляют в зависимости от эпидемиологической обстановки в стране. Также был разработан национальный клинический протокол по лечению больных COVID-19, национальные протоколы по выявлению и лечению пациентов, инфицированных COVID-19 и наблюдения за ними. Важно отметить, что мобилизация всех партнеров по развитию гражданского общества и общества в целом в вопросах пожертвования средств индивидуальной защиты, медицинских изделий, медикаментов и расходных материалов остро необходимых для реагирования на COVID-19. Уважаемые присутствующие, пандемия COVID-19 показала, насколько хрупки системы здравоохранения, социальные и экономические системы большинства стран в условиях глобальной пандемии. И насколько необходимо, чтобы каждая страна развивала и организовывала сильные системы охраны общественного здоровья, способные реагировать на чрезвычайные ситуации в общественном здоровье и обеспечить всех граждан рентабельными и доступными медицинскими услугами, чтобы никто не оставался без внимания вне зависимости от возраста, места проживания, пола, национальности и другие. Таким образом, проект национальной стратегии здравоохранения 2030, инициированный Министерством здравоохранения, труда и социальной защиты в Республике Молдова, находящийся на завершающей стадии, определяет направление формирования и преобразования системы здравоохранения Республики Молдова на ближайшее десятилетие. Этот проект был разработан в соответствии с обязательствами по повестке устойчивого развития 2030 и целями устойчивого развития. В рамках этого процесса Европейская программа работы на 2020-2025 года «Совместные действия для улучшения здоровья», документ, который инициировали вы, господин региональный директор, после вступления в должность, указывающий способы практической реализации глобальной программы работы. Эта программа стала для нас ценным источником вдохновения, особенно в том, что касается всеобщего охвата качественными услугами здравоохранения, защиты от рисков в сфере общественного здоровья и продвижения здоровья и благосостояния граждан на протяжении всей жизни с учетом уроков реагирования на пандемию COVID-19. Ситуация с COVID-19 еще раз доказала важность и роль Всемирной организации здравоохранения в вопросах оказания поддержки в сфере регулирования и информирования, а также важность активного участия стран-членов и рабочих органов, организаций и внедрения лучших практик в деле укрепления систем здравоохранения и улучшения населения. В заключение хочу выразить признательность за всю поддержку, оказанную Всемирной организацией здравоохранения в процессе управления пандемией COVID-19 в Республике Молдова, в особенности команде странового бюро в лице господина директора Игоря Поканевича. Мы также очень ценим значительные усилия Всемирной организации здравоохранения и в управлении кризисом в общественном здоровье на глобальном уровне и усилия, предпринимаемые для разработки эффективной и безопасной вакцины и обеспечения ею всех стран, включая Республику Молдова. Спасибо за внимание.
Thank you very much. I now give the floor to Latvia to be followed by Israel. Latvia, you have the floor.
Dear Director General, Regional Director, colleagues, first let me thank the Regional Committee for the opportunity to address you and express my appreciation for the work done by the WHO throughout this challenging time. Latvia believes that evidence-based practice is the solution to our current challenges. Looking back at the COVID-19 developments in Latvia, the greatest lesson that we have learned, all taken decisions must be evidence-based. Our government has seriously considered our epidemiologists and other experts' advice during decision-making process. Our guiding principles are based on 3 pillars: test, trace, and isolate. Moreover, engagement of society and observation of physical distancing are also important. We have enjoyed relatively safe summer. Now in Latvia, we have reopened schools and face-to-face learning. We believe that Latvia has managed situation well, balancing health and other sectors' interests. Currently, the coordination and exchange of information among countries, institutions and organizations is indispensable. Timely guidance by the WHO is critically important. COVID-19 showed how crucial is work done by the health ministries and by the WHO. In this regard, we want to congratulate the Regional Committee and Hans Kluge especially on the new European work program. It includes crucial elements in order for us to better serve our people: stronger emergency preparedness, universal health coverage, the need to strengthen collaboration, mental health, and others. Despite the progress made in the fight against COVID-19, we cannot relax as the pandemic has not been defeated yet and the vaccine is still under development. We can do well if we base our decisions on the scientific knowledge instead of giving into political pressure. Thank you.
Thank you very much. I now give the floor to Israel, to be followed by France. Israel, you have the floor.
Thank you very much, Director General Dr. Tedros, Regional Director Dr. Kluge, fellow ministers, and the member states representatives. First of all, this meeting was supposed to take place in Israel. It is not happening for two main reasons. One is widely known, the terrible COVID-19 pandemic we're all fighting together. The other reason may be less known. I was supposed to host the meeting in Israel, but several days ago during a working meeting in my office, one of the colleagues after the meeting was tested positive for the coronavirus. So right now I'm isolated in my house talking to you from my dining room. But I sincerely hope that our regional meeting in 2022 will happen in Israel, and I will have the pleasure and honor to host you all here. In my last 3 months in the Ministry of Health of Israel, I visit different Israeli hospitals every day. And I admire the incredible effort of doctors and nurses and everyone involved in, on one hand, fighting the pandemic, on the other hand, continuing to give all the other necessary services to the Israeli citizens. So on behalf of myself, and I'm sure on behalf of all of us, I want to express a lot of gratitude to the medical teams all around the world, in every country, who are working nights and days on behalf of our health, on behalf of all of us. I also want to thank the WHO for supporting and coordinating many aspects of the response to COVID-19 and other pressing health challenges. There has been some debate about the future direction of the WHO in the context of current pandemic. Israel advocates for the strengthening of the World Health Organization and recognizes the importance of its task, especially given the current crisis. We encourage the WHO to embrace a reform process, an independent audit and review. We also encourage further dialogue between member states and WHO headquarters. Despite the fact that we're all focused on the fight against COVID-19 night and day, we should be working to integrate lessons learned as well as prepare for the day after. Health systems will struggle to budget and ensure funding in an era of economic upheaval that is expected to worsen as the COVID-19 fight continues. In every crisis, they say, there is an opportunity. The corona crisis brought with it development and integration of many new technologies. And the WHO should work to ensure that health systems will continue to benefit from these technological advancements once the crisis has passed. Israel, sometimes fondly referred to as the startup nation, will be more than happy to participate in this global effort. Lastly, together, let's find better ways to manage emergency and provide assistance to countries in times of health crisis. I would like to express solidarity with all countries of the world, Israel among them, under the current pandemic, and express our desire to deepen collaboration with partners, new and old, in this important battle which unites all of humanity. I look forward to hosting you in Israel in 2022. Thank you.
Thank you very much, Israel. I now give the floor to France, to be followed by Portugal. Delegate of France, you have the floor.
Monsieur le Président, Monsieur le Directeur Général de l'OMS, Monsieur le Directeur Régional de l'OMS Euro, Mesdames et Messieurs les ministres, Mesdames, Messieurs, chers collègues, je me félicite de la tenue de cette 70e session du Comité régional de l'OMS Euro et je m'associe à la déclaration prononcée par l'Allemagne au nom de l'Union européenne et de ses États membres. Alors que la pandémie de Covid-19 continue d'affecter l'ensemble des États du monde et que de nombreux pays de notre région, dont la France, connaissent une augmentation du nombre de nouveaux cas, la France poursuit sa mobilisation. Au niveau national, dans un contexte de relance économique marqué par la publication récente d'une feuille de route nationale pour la refondation économique, sociale et écologique, j'ai à cœur de défendre plusieurs leviers d'action stratégique, en particulier apporter un soutien continu aux professionnels de santé dont la mobilisation a été sans faille depuis le début de la crise. Continuer d'investir pour l'accélération de la recherche et l'accès universel et équitable aux vaccins, traitements et diagnostics contre la Covid-19 et le renforcement des systèmes de soins à travers notamment l'initiative ACTA. Œuvrer chaque jour pour que la santé demeure un bien public mondial et faire de la lutte contre les inégalités de santé une priorité. Je me dois à cet égard de saluer les actions menées par l'OMS Euro et sa collaboration forte avec l'Union européenne et ses États membres, et je me félicite de l'élaboration du programme de travail européen 2020-2025 qui devrait être adopté aujourd'hui. En présentant sa candidature au Conseil exécutif de l'OMS en mai 2021, la France entend témoigner de son engagement et de son soutien à l'OMS. Car plus que jamais dans le contexte actuel, nous avons besoin de l'OMS pour son rôle crucial de coordination, son expertise scientifique et sa connaissance du terrain. La France porte à cet égard, conjointement avec l'Allemagne, des propositions pour renforcer l'architecture multilatérale de santé, que ce soit à travers une meilleure mise en œuvre des normes en matière de sécurité sanitaire internationale, une amélioration du système d'alerte et de réaction aux urgences, ou encore par un renforcement des connexions entre santé humaine, animale, environnementale, selon l'approche « une seule santé ». Nous souhaitons par ces propositions susciter une mobilisation des États membres afin de soutenir les travaux et recommandations du panel de haut niveau chargé de l'évaluation de la riposte à l'épidémie. Mesdames, Messieurs, il est crucial de poursuivre ensemble nos efforts à l'échelle de la région européenne, mais aussi à l'échelle mondiale, pour lutter contre la Covid-19 et en tirer les enseignements pour renforcer de façon durable nos systèmes de santé et les rendre toujours plus sûrs, efficaces, résilients et justes. Je vous remercie.
Thank you very much, France. I now give the floor to Portugal, to be followed by Spain. Portugal, you have the floor.
Mr. Director General, Mr. Regional Director, distinguished President and members of the Regional Committee. It is an honor and a privilege for me to speak at the 70th session of the Regional Committee for Europe on behalf of Portugal. Portugal aligns itself with the statement made by Germany on behalf of the European Union. Mr. Regional Director, dear Hans, let me begin by thanking you for the work you have done since your election, for which I congratulate you. You took this responsibility against the backdrop of a pandemic, the scope and impacts of which made this period probably one of the most challenging in the organization's long history. Today, it is clear that the scope and complexity of the WHO's mandate and the present and future importance of its intervention require a corresponding provision of resources. The evaluation of the organization's response to the pandemic will only be useful if it results in the expected revamping of the organization. It should be grounded by a broad commitment between its member states and allow for the future allocation of the resources needed to respond to incoming challenges. Portugal reiterates its support to WHO and to multilateralism. It is the only approach capable of responding to global crises such as the one we are facing. Among the multiple lessons to be learned from the COVID-19 pandemic, we should highlight that only together and in solidarity can we fight, mitigate the effects, and more importantly, prevent outbreaks of similar nature in the future. The current unprecedented efforts to find a vaccine illustrates the renewal of the paradigm of multilateral cooperation that the international community should aim for. The access to COVID-19 tools accelerated that Portugal is proud to support is an historic example of global collaboration. Mr. Director General, Mr. Regional Director, we have before us an opportunity to end many inequalities, including those that persist in our social protection and health systems. A leap forward towards an equitable and inclusive future with more resilient and responsive social protection mechanisms is needed. Health and well-being are internationally recognized human rights and must play a central role in our response and recovery. In this context, I underline Portugal's commitment to the 2030 Agenda and the Sustainable Development Goals, and among these, Goal 3, ensuring healthy lives and promoting well-being for all at all ages. Such a design as a direct translation into the universal call of our National Health Service, a cornerstone of social inclusion and a guarantee of universal health care in which access and equity are safeguarded. Access to timely, adequate and quality health care services is often one of the main constraints that, if not properly addressed, may contribute to a deterioration of the health status of migrant and refugee populations. In the last years, Portugal has designed policies and enacted legislation making the promotion of migrant and refugee health a priority, guided by an inclusive, non-discriminatory, humanistic approach. Lastly, within this compromise, we also recognize the obligation to strengthen support for mental health. It is an urgent need dictated not only by the historical lack of investment in the area, but also because of a very significant increase in the incidence of acute conditions, all stemming from the psychological suffering caused by COVID-19 and the measures implemented to tackle it. We see the most vulnerable not as a burden, but as an opportunity to the welfare of our country, one to be managed, namely through the implementation of resilient, inclusive and effective health policies, supported by a single aspiration: no one is left behind. This principle has guided our country's work for the protection of human health in the last 40 years. It is today, in the challenging context of the COVID-19 pandemic, even more fundamental. Thank you.
Thank you. I now give the floor to the delegate from Spain, to be followed by Finland. Spain, you have the floor.
Dear delegates and colleagues, Spain aligns with the European Union and its member state statement. The COVID-19 pandemic has shown us that no country can face this challenge on its own, and we acknowledge the leadership of World Health Organization and its Director General in the response. We also recognize the practical support and cooperation provided by World Health Organization Europe. Spain is fully engaged with WHO, and we appreciate the efforts to invigorate the organization in view of COVID-19. We support the three main priorities about a universal health coverage. This is one of the most relevant priorities in my country, aligned with the objective of Agenda 2030. Spain believes in the One Health approach to include the human, animal, and environmental dimension of health, as all ecosystems are interconnected. We share the vision of leaving no one behind and empowering leadership in health, expecting that this united action includes the gender perspective and equity. On the other hand, we welcome the Access to COVID Tools Accelerator initiative, being Spain a founding member. We consider immunization against COVID-19 as a global public good. Spain wants to work closely with WHO as members of the ACT Facilitation Council. The challenges are still numerous. Work to be faced requires coordinated force at the national and international level. For this reason, Spain offers to continue collaboration international initiative promoted under Dr. Klage's mandate. Thank you, Chair.
Thank you very much. I now give the floor to Finland, to be followed by Sweden. Finland, you have the floor.
Honorable President, Your Royal Highness Princess Mary, Director General, Regional Director, Excellencies, dear delegates. Finland aligns herself with the statement of the European Union and its member states. Finland thanks the Regional Office for the continued support during the COVID-19 crisis. The pandemic has been a test to our health systems and societies, as well as to one WHO, one UN approach. Some weeks ago, in highlighting the importance of multilateral cooperation, our Prime Minister underlined WHO's invaluable work in pandemic response and in other areas of global health. The pandemic has deepened existing inequalities and had an impact far beyond health. More than ever, we see the importance of investing in prevention and health promotion, health system strengthening, essential public health functions, and social protection. Protecting the most vulnerable and ensuring a human rights and gender-responsive approach is critical. The pandemic response has pushed a rapid digital leap. In Finland, we have seen the importance of trust in health authorities and public services, a well-functioning infrastructure, and the government's commitment to ensure fundamental rights. In less than a week, 30% of our population downloaded the COVID-19 tracing app, and the number is increasing. The transition to distance education has been successful according to recent studies. Finland stands ready to support the evaluation processes at regional and global levels. We look forward to the outcomes of the Pan-European Commission on Health and Sustainable Development and are delighted that President Halonen will bring her experience and knowledge to the group. Investment in health and well-being is a prerequisite for sustainable economic, social, and environmental recovery. We are committed to making the economy of well-being the new norm and building back better. Thank you.
Thank you very much. And I'll give the floor to the delegate from Sweden, to be followed by Switzerland. Sweden, you have the floor.
Director General, Regional Director. Sweden aligns itself with the statement made on behalf of the European Union and its member states. WHO plays a crucial role in providing leadership, coordination, knowledge and support to all countries. We thank the Director General for his commitment to fulfill the obligations in the WHO resolution on COVID-19 response, such as achieving global equitable access to vaccines and the evaluation process of the WHO coordinated international health response. All affected countries are now trying to solve the crisis with as few negative consequences for people's lives and health as possible. The pandemic has affected the prioritization in health systems to provide healthcare for COVID-19 patients and increase the number of ICU beds, elective surgery, cancer screenings and doctor visits have had to be postponed or rescheduled. Access to SRHR has been impaired. Returning to a new normal must involve health system strengthening and a renewed focus on enabling people to live healthy lives. We appreciate the broad public health perspective the regional office has taken in its response to COVID-19. One example is the negative impacts response measures have had on public health, such as increased mental health issues, domestic violence, elderly in isolation, as well as the adverse effects on children when closing schools. Another example is the socio-economic impacts of the pandemic, which may lead to a further exacerbation of existing health inequalities. Vulnerable groups have been especially affected by the pandemic. Sweden will not let this pandemic prevent us from achieving the goal of reducing avoidable health inequalities within a generation. Thank you.
Thank you very much. I now give the floor to Switzerland. Switzerland, you have the floor.
La Suisse vous remercie, monsieur le directeur général. La Suisse vous remercie pour votre rapport concernant les activités de l'OMS Europe en 2019 et 2020. Nous aimerions exprimer notre profonde appréciation pour votre travail acharné pendant cette première année de mandat. Marquée par les défis sans précédent, vous avez admirablement su guider la région pendant des moments difficiles sans perdre de vue les adaptations et réformes nécessaires. Vous avez également contribué à une bonne complémentarité entre les activités de la région européenne et celles du siège global de l'OMS national. La pandémie nous sépare aujourd'hui physiquement, mais elle nous rapproche en même temps dans le cadre de notre lutte commune face à un ennemi commun. La crise nous a obligés à repenser nos systèmes de santé et notre préparation aux urgences sanitaires. Elle a mis à l'épreuve nos liens entre voisins et notre collaboration sur le plan sanitaire. Comme vous l'avez souligné, elle a révélé un fort besoin de solidarité au sein de notre région. Aucun pays ne peut sortir de cette crise tout seul. Afin de contribuer à la réflexion pour renforcer l'OMS dans son rôle central, la Suisse a lancé, avec le Botswana, le Népal et Oman, une coalition pour une architecture universelle de protection sanitaire. Une communication transparente et une action coordonnée sont cruciales pour la lutte contre la pandémie. Une piste importante que vous avez amorcée est d'améliorer la coopération avec le Centre européen de prévention et de contrôle des maladies. Pour mettre en œuvre son projet, l'OMS Europe doit disposer des ressources nécessaires. Certains programmes restent très inégalement financés dans le budget 2018-2019 et dépendent de contributions volontaires, en particulier le pilier promotion de la santé tout au long de la vie et le programme d'urgence sanitaire. Une réflexion pour améliorer la prévisibilité et la flexibilité des contributions est donc nécessaire. La Suisse s'inquiète également de l'accès aux services de santé dans les contextes humanitaires. Nous saluons l'engagement de l'OMS Europe à la frontière turco-syrienne et la création d'un nouveau centre d'excellence pour la préparation aux situations d'urgence humanitaire et sanitaire à Istanbul. L'appel à l'action que nous avons lancé avec l'Afghanistan visant à renforcer la couverture sanitaire universelle dans les situations fragiles reste donc d'actualité. La Suisse continue de s'engager pour améliorer l'accès aux produits médicaux. Nous saluons les efforts en vue de mettre en œuvre la résolution WHA 728 sur l'amélioration de la transparence des marchés de médicaments, de vaccins et d'autres produits sanitaires. Afin d'accélérer la sortie de crise, la Suisse est convaincue qu'il faut garantir, par des solutions innovantes, une distribution équitable de produits médicaux contre la COVID-19. Mon pays s'est engagé dans les discussions visant à accélérer la production et l'accès à un vaccin. le COVID-19 Vaccine Global Access Facility. Je vous remercie.
Thank you very much, Switzerland. We have now completed the pre-established list of speakers from member states. During our discussions, a number of delegations have raised their hand inside the Zoom platform requesting the floor. So I'll now give the floor to the delegate of Greece, to be followed by Poland. Greece, you have the floor.
Dear Director General Dr. Tedros, President Troy, thank you, Chair, Your Royal Highness Princess Mary of Denmark, President Hill, dear Director General of the
Excuse me, Greece. We have very, very bad sound from you. So I think, should you try to reconnect, or maybe well, I'll just suggest we go to Poland and then we'll get back to Greece because the sound connection is very bad. So if Poland is ready, I'll now give the floor to Poland and we will get back to Greece afterwards. Poland, you have the floor.
Hello, everybody. Good afternoon. Director General, Dr. Tedros, Regional Director, Dr. Kluge, colleagues. Poland fully aligns with the statement delivered by Germany on behalf of the EU and its member states. To start with, I would like to express our appreciation for WHO's efforts in combating COVID-19 pandemic both at global and regional level. On March 14, Poland declared a state of epidemic threat. It has been exactly 6 months ago. On that day, our lives have changed. Looking back, we can conclude that Poland has stood up to the challenge. We have transformed some of our hospitals into so-called one-named hospitals, facilities dedicated solely to treating COVID-19 patients. In the peak period, we had 22 such hospitals. Also, statistics speak for themselves. Total number of infected people in Poland amounts little more than 73,000, with unfortunate number of a little more than 2,000 deaths, but over 58,000 recoveries. Over the last half a year, a lot has been done, but yet there is still a lot to do ahead of us. We are preparing ourselves for the second wave of epidemic and the seasonal flu to come. Ministry of Health encourages Polish citizens to vaccinate against flu. However, at the moment, we are facing problems with access to the vaccines. We all must ensure that such situation will not happen in the case of the future COVID-19 vaccine. The global goal should be as follows. Both the drug and the vaccine will be equally accessible for all at affordable price so that no one is left behind. Only by uniting our efforts we can combat COVID-19 and the challenges it has brought. Therefore, we ask the whole international community to unite its effort in a spirit of trust and solidarity. For Poland, solidarity is one of the core values. During the first hit of the epidemic, Polish Center for International Health has sent medical teams to Italy, Tajikistan, and Kyrgyzstan to support their efforts in fighting COVID. Director General Dr. Tedros, Regional Director, colleagues, it has been difficult 6 months. Life has given us a tough lesson. Now it is our task to draw conclusions, avoid repeating mistakes and making steps forward in order to finish this crisis. I am sure that our united efforts will bring positive results. We are strong only together, united in actions. Thank you.
Thank you very much, Poland. We will now try and re-establish connection with Greece. Greece, you have the floor.
Denmark, President Troy, dear Director General of the
I'm sorry, Greece, we are not getting sound from you. I'm sorry about that. Should we try and reboot Greece, the connection with Greece?
The second time.
Oh, yeah, this is much better. Now it's working. Sorry about that.
Thank you very much. And I'm sorry about the connection.
Now it's very...
Fair.
Okay, go ahead. Let's see if it works.
Your Royal Highness Princess Mary of Denmark, President Toy, dear Director General Dr. Tedros, dear Regional Director Dr. Kluge, dear colleagues, Ministers of Health, ladies and gentlemen, I would like on behalf of the Greek government to express our deepest appreciation to both Dr. Tedros and Dr. Kluge for their continued support and collaboration during this unprecedented time. Our work continues to be centered on our commitment to achieving universal health coverage in the country. Our efforts in this front have been far-reaching, were reinforced by the political declaration of the high-level meeting on universal health coverage last year in New York, as well as the declaration of a fund on primary health care that was adopted in October 2018 in order to leave no one behind. While we have made great strides in health outcomes globally over the past 40 years, we face many ongoing challenges. COVID-19 has shown us that we have to rethink our way of operating amidst the pandemic. A primary healthcare approach is the most effective way to sustainably solve today's health and health system challenges. We are convinced that strengthening primary health care is also the most inclusive, effective, and efficient approach to enhance people's mental health, but especially during the pandemic is under enormous pressure. There is no UHC without PHC, no health without mental health. These mottos are now more relevant than ever before. During the first wave of the COVID-19 pandemic, we, thanks to the determination of our Prime Minister Japanese society and the guidance of a high-level team of national experts, have finally taken all the necessary measures that effectively slowed down the spread in the country. In view of the next stages of the pandemic, the Prime Minister, realizing the need to strengthen mental health services, created advice ministries that will deal with this issue, as well as the further the development of the psychiatric reform in the country. We are finally very pleased to see that the European Program of Work, developed under the regional director Dr. Kluge's leadership, is so pioneering and comprehensive, including mental health as one of its four flagships, and we are reassured that the real and the great impact the EPU will have in our country is ahead of us, but also in our region as a whole. Thank you very much for your attention.
Thank you very much, Greece. And I do apologize that the sound was not perfect, especially for the first 2 minutes of your intervention. So I'm very sorry that we were not able to provide interpretation. I would suggest that we circulate the intervention from Greece as a written statement, if that's acceptable to Greece, as we did not, we were not able to provide interpretation. Seems acceptable. Thank you very much. We have now exhausted the list of member states asking to take the floor on this agenda item, and I would now like to proceed to give the floor to observers. We have the Secretariat has received 7 requests from partner organizations to take the floor. And first, I would like to give the floor to the United Nations Population Fund, UNFPA, to be followed by the UNECE. Mr. Ian McFarlane, you have the floor. So, Mr. McFarlane, we do not have sound at your end. Maybe you should try unmute. There seems to be a technical problem in connecting with the UNFPA. So we will move on to the United Nations Economic Commission for Europe, the UNECE, and then we'll get back to the UNFPA afterwards. Mr. Olga Algarayeva, you have the floor.
Thank you, Mr. Chair. Excellencies, Director General dear Tedros, Regional Director dear Hans, distinguished delegates and colleagues. I'm very pleased to speak on behalf of the UN Economic Commission for this region, or UNEC in short, at the regional committee today. The fact that we are meeting virtually shows that we continue to face an extraordinary public health situation, and I would like to commend here WHO for the impressive leadership in these difficult times. We have heard today from distinguished delegations about many decisive measures taken by the governments, as well as about the huge adverse effects of the pandemic on the lives, health, and well-being of many people, not only in our region, but worldwide. Moreover, it has led to a dramatic worsening of the economic and social situation, with poverty, unemployment, and inequalities rising. We could also see a negative impact on many other of the UN Sustainable Development Goals, the SDGs, for example, on education or gender equality. But what we have learned from these experiences so far? In the interest of time, let me focus just on 3 points. First, in the time of crisis, we need to maintain multilateral and regional coordination and preserve connectivity. We have seen during the crisis that the border closures and mobility restrictions have severely impacted transport and trade, compounding the economic downturn and even affecting the delivery of critical supplies. We must keep borders open for transport and movement of goods. My organization, UNEC, is working besides others on instruments for electronic business and paperless trade that can minimize person-to-person contact during the pandemic. Second, we must continue to mitigate the socio-economic impact of the pandemic. To this end, the UN at the global, regional, and country levels is providing support and policy tools to governments to help them respond to the social and economic consequences of COVID-19 within the different national situations. Last but not least, looking ahead, it's crucial to embark on a green and sustainable recovery from COVID-19. The Sustainable Development Goals are an excellent blueprint for building back better, and we should put them at the center of our recovery efforts. All of this will require partnerships and cooperation, and I'm therefore very pleased that this is also very much the spirit of WHO's new European program of work. As UNEC, we look forward to continuing our long-standing cooperation with WHO Europe, for instance, on water and health, and on transport, health and environment, and to further developing our partnerships. Thank you.
Thank you very much. I will now see if we have re-established connection with the UNFPA. Go ahead, you have the floor. I'm sorry, Mr. McFarlane, that we're not getting sound through, so we'll just move on with the list of speakers and then we'll get back to you at the end. So moving on, I'll now give the floor to the Office of the United Nations High Commissioner for Human Rights, Ms. Marie-Dominique Perrin. You have the floor.
Thank you very much, Honorable Chair, distinguished delegates. To enjoy the highest attainable standard of physical and mental health is a fundamental human right. Since the start of the pandemic, the Office of the UN High Commissioner for Human Rights has been working with WHO to support member states and partner organizations in protecting this right, in particular for persons in situation of vulnerability. Together with WHO, we produced the guidance on COVID-19 and persons deprived of their liberty. As we draw lessons from the pandemic in Europe, it is essential that health strategies consider not only its medical dimensions, but also the human rights consequences of measures taken in response, as well as the underlying reasons why some groups have been disproportionately affected, including older persons, persons with disability, women, LGBTI persons, migrant and refugees, the poor. The disproportionate death toll in residential care facilities in Europe notably in older persons' homes, is a wake-up call to address the chronic neglect of the long-term care sector. This should include increased funding and better protection of care work, including auxiliary workers. It also includes moving away from institutionalization to prioritize integrated and community-based approaches to care, in line with the UN Convention on the Rights of Persons with Disabilities. No one is safe until everyone is safe. Access to information, testing, and care should therefore be available, accessible, and affordable to all without discrimination, including migrants and refugees, regardless of their status. This implies securing firewalls to separate immigration enforcement activities from the ability of migrants and refugees to access health services. Human rights can and must guide COVID-19 response and recovery. The UN human rights systems and national human rights institutions have produced numerous guidance to that effect. OHCHR stands ready to continue supporting member states and partner organizations to leave no one behind. Thank you.
Thank you very much. Next, I give the floor to the Committee of the Regions. Ms. Sagradeus, you have the floor.
Thank you that you invite EU Committee of Regions. And as the director said before, that it's the cities and the regions who are in the forefront of the COVID-19. We take care of the schools, the elderly homes, the primary care, and 20 out of the 27 hospitals. We in the Committee of Regions, we have been very active, and we had also formed an exchange platform for cooperation and support. And I invite all of you to look at this COVID-19 exchange platform. It's open for all. And in May, we took a declaration how we should work together to coordinate and support each other. But also for a long term, we have to work together. And especially what was mentioned before, cross-border cooperation, but also is very important to strengthen digitalization, very important, robust healthcare systems, and also training the health professionals is, of course, of importance. I am a rapporteur of the EU Health Emergency Mechanism, and that means that we want to try to coordinate EU actions and support. And we are very happy to work with the WHO in this. And we also think that distribution in the EU is very important, that we help each other out there, and also to maybe in the future have more of joint procurement when it comes to essential medical equipment. And also it's good to strengthen the ECDC, the European Centre for Disease Prevention and Control. Very important. We have many opinions, EU for Health, cross-border, and what is done during the pandemic, we will also discuss in the plenary, in the Committee of Regions. But the best thing is that we all work in cooperation, that we work for, because we all know that health is wealth. Thank you.
Thank you very much. Moving on, I now give the floor to the Organization for Economic Cooperation and Development, the OECD. Ms. Francesca Colombo, you have the floor.
Thank you. Thank you very much for the opportunity to speak. The OECD really stands ready to work with all countries, and they continue the very excellent long-term collaborations that we have had with you, Hans Kluge, with your office, the regional office in Europe. And this is not just in addressing the economic and health consequences of COVID-19, but more broadly on strengthening health systems. The main point I would like to pass through today is that collectively we need to become much, much better at working through the economic consequences of developing health policies. And this has to do with issues that go beyond COVID-19. Think about antimicrobial resistance, think about investing in health workforce, think about the mental health, which is an issue beyond obviously just COVID-19. But to make 3 points about the current crisis, it's quite clear at first that we need to prevent ill health while fostering a more resilient economic recovery. And that countries have really made efforts which are Herculean to drive down infections, to prevent hundreds and thousands of loss of lives. But the economic consequences have been really very much catastrophic, and moving beyond, we need to enhance really not just public health measures, but also the collaborations, and need to work together with employment, with social authorities to foster a much stronger and inclusive recovery while preserving obviously the health of populations. Second, in relation to vaccine, it's clear that effective vaccines is the best hope to end these pandemics, and success is all but guaranteed in the current context, even despite the major progress which have been made. International cooperation is clearly essential. Multilateral commitments to pay for successful candidates give manufacturers certainty so that they can move on into scaling up production. But while leaders obviously want and face political pressure to put the health of their citizens first, it is more effective and also more efficient to allocate vaccines based on needs. If one country achieves full vaccination, but their trade partners do not only will the global health toll remain high, but also the economic consequences will remain dire. And thirdly, in terms of health system resilience, there have been tremendous accelerations in all sorts of innovations, particularly in the digital space, advances in use of digital health, telemedicine, also advances in roles for health professionals. And we must be able to build on those innovations in order to build the resilience of populations' whole health system, and continue also to make an economic case for investment in public health that still remain only 3% of health expenditure. With that, I really look forward to working with all the countries and continue our excellent collaborations with the regional offices to address these issues. Thank you very much.
Thank you. I next give the floor to the Red Cross and Red Crescent Societies. Mr. Elkan Rahimov, you have the floor.
Thank you very much, Mr. Chairman, representatives of member states and the partner organizations. Thank you very much for this opportunity to really welcome you today on behalf of International Federation of Red Cross and the Red Crescent Societies. Our meeting today takes place in extremely challenging times when the global COVID-19 pandemic has affected the lives of millions of the people. Every day, 1,000 more people get infected, some people die. This has become a serious test not only for national health systems, but also for the resilience of our local communities. The IFRC and 192 national societies are responding to this pandemic in accordance with the statutory mandate and the auxiliary role. As part of IFRC emergency appeal, national societies in Europe supporting public authorities in prevention, treatment of the disease, and present in the communities through the network of volunteers and staff. They are providing pre-hospital care and medical services to affected people. They're also supporting public health measures to control the outbreak, such as running testing stations, engaging with the community to track and counter misinformation. Many people have lost their jobs as a result of the pandemic, so we are providing livelihood support and other assistance to address the social economic impact of the COVID-19. Similarly, we are supporting Red Cross, Red Crescent national societies and their dedicated staff and volunteers to effectively prepare and respond. IFRC and all national Red Cross and Red Crescent societies work in a collaborative spirit with WHO Europe at regional and country level. There is a very close established cooperation to join efforts to contribute to the reduction of the morbidity, mortality, and social impacts of COVID-19. IFRC endorses the addresses of WHO Director General and Europe Regional Director and stands ready to partner with governments, UN agencies, civil society, the corporate sector, and communities themselves to turn our common goals and ambitions into reality. Thank you very much, Mr. Chairman.
Thank you very much. I next give the floor to the United Nations High Commissioner for Refugees, UNHCR. You have the floor. UNHCR, you have the floor. We are not getting sound. Maybe you have to unmute. Okay, I will just move on and then I'll go back to the UNFPA, Ms. McFarlane. I believe we have now reconnected and should have re-established sound connection. So UNFPA, you have the floor.
Thank you very much, Mr. Chair. Can you hear me now?
Yes, perfectly.
I think I just needed to put my jacket on. My apologies for not being appropriately attired. Perhaps that's what it was. To be serious, though, thank you very much, Mr. President, Director General, Regional Director, Honourable Ministers, Excellencies, distinguished delegates, ladies and gentlemen. I'm very honoured to address the committee today on behalf of UNFPA, the UN's Sexual and Reproductive Health Agency. And I would like to express my deep felt appreciation to WHO, particularly to Dr. Kluge and his team for our long-standing and ever-intensifying cooperation in the framework of our joint SRH programme and many other interagency initiatives at the global, regional and country levels. Excellencies, under the leadership of Member States, we have a shared agenda of advancing the health and well-being of the people in the European region within the immediate and urgent need of responding to COVID and in the true spirit of building back better to achieve the Sustainable Development Goals for everyone, everywhere. But as we've heard today, the pandemic has exposed the strengths and the weaknesses of health systems across the region, including when it comes to protecting the rights of the most vulnerable, such as older people or people with disabilities. This is particularly true for access to sexual and reproductive health and services. Even in the midst of a pandemic, people need contraceptives, women need care during pregnancy, and they need to be able to give birth safely. We've seen remarkable examples of national authorities stepping up to ensure the continuity of SRH services, training and protecting thousands of health workers to enable them to ensure that every birth is safe and that SRH information and supplies are available. And we've seen some truly heroic efforts from national authorities and civil society to reach marginalised groups to ensure access to care, including for survivors of violence. These efforts need to be continued and sustained with political will and financial resources. Hard choices will have to be made, but in making those choices, we would urge Member States to continue to pay attention to the needs of women and girls, especially those furthest behind, so that they too can exercise their rights and choices. May I also draw attention to the committee to an additional opportunity that we have together to respond to the pandemic and continue vital essential services for sexual and reproductive health. And that is the landmark regional action plan on sexual and reproductive health towards achieving the 2030 agenda for sustainable development in Europe, leaving no one behind, which was approved previously by the committee. Much progress has been made in developing and implementing rights-based national action plans derived from that approved regional plan, and it's critical to maintain the results and strengthen them so that when Member States report in the coming year, they'll be able to celebrate their success in delivering for women and girls in all the countries. Excellencies, we reiterate our full commitment to working together with Member States, our partners at WHO and the UN system to achieve the SDGs for everyone, everywhere, to deliver on the commitments that Member States made at the Nairobi Summit on ICPD at 25, and to ensure that the European Member States build back better and more resilient, particularly to make sexual and reproductive health a reality for all in this region. I thank you for your attention, and once again, my apologies for the technical difficulties. Thank you.
Thank you very much, and we will now try to see if we can establish connection with the United Nations High Commissioner for Refugees. UNHCR, you have the floor.
Thank you, Mr. Chairman. Can you hear me well?
Yes, go ahead.
Dear Mr. Chairman, Director General, Regional Director, distinguished delegates, the Office of the UN High Commissioner for Refugees would like to thank the Regional Director for the report presented this morning. We would like to express our sincere appreciation for WHO's leadership and coordination role within the UN family in the health-related response to the COVID-19 pandemic. The pandemic posed new challenges to us all in Europe. It tested the strength and resilience of existing asylum systems and the capacities of states to innovate and preserve access to territory amid an unprecedented global public health crisis. While some measures taken initially raised some concerns, the majority of states in Europe have eventually managed to take action that balanced international protection obligations and public health considerations. With regards to the pandemic response in Europe, UNHCR has been advocating for the inclusion of refugees, asylum seekers, and other people of concern in national COVID-19 preparedness and response plans in the spirit of the 2030 Agenda. We are thankful to states who have done so, especially given the socioeconomic impact of the pandemic on everyone. We also welcome the inclusion of people of concern to UNHCR in socioeconomic recovery frameworks, as well as in the WHO's European Programme of Work. UNHCR will continue supporting national authorities in setting up such plans and responses where required, including by improving access to water and sanitation, ensuring quarantine and isolation areas are functional in refugee reception centers, and that sanitary protocols are in place to ensure people fleeing conflict and persecution continue to be able to access territory. This unprecedented situation has also provided opportunities to demonstrate solidarity between communities and enhance community-based communication platforms, which we should capitalize on. Let me conclude, Mr. Chairman, by reaffirming UNHCR's readiness to continue supporting states in their response efforts, as well as WHO at all levels, as exemplified by the signing of a new global agreement between our two organizations in May this year. Thank you for your attention.
Thank you very much. We have now completed the pre-established list of speakers from UN agencies, intergovernmental organizations, and other partner organizations. We have now noted also a request from a member state for the floor, so I will now give the floor to the delegate of Georgia. Georgia, you have the floor.
Thank you. First of all, I would like to take this opportunity and thank you all for enormous efforts and solidarity in the fight against COVID-19. Starting from January, Georgia government has been taking drastic measures to contain the spread of COVID-19 by employing social distancing measures, mobilizing healthcare facilities and public health institutions for timely testing and contact tracing. With these measures in place, Georgia has been recognized as one of the green countries with only 700 active cases for the moment. The COVID-19 crisis revealed many challenges faced by the health system in mobilizing human resources, having equal access to quality diagnostics and critical care services, creating safe healthcare environment for avoiding nosocomial transmission of the disease. In these circumstances, it became even more important for Georgia to revisit its public-private partnership framework in health and initiate policy dialogue aimed at redefining roles of public and private establishments in emergency response. Given that more than 85% of health facilities in Georgia are privately owned, the government has decided to leverage the capacity of the private facilities while at the same time strengthening the public facilities to fill critical gaps. Building regulatory framework for infection controls, improving critical care capacity, strengthening primary care services and public laboratories, building capacity of healthcare workers in disease surveillance were identified as priority areas for investment. Many developmental partners offered their assistance. In May, Georgia initiated the crisis response project supported by the World Bank and AIIB. Additional investments will be mobilized to renew over 700 hospital beds in public sector and strengthen community-based health services. Upcoming investment projects will aim at building resilient health systems that contribute to the achievement of health outcomes, optimizing the delivery of quality services towards universal health coverage and reducing risk due to epidemics and other health threats. We all know that the health sector alone could not address health-related risks during the COVID epidemic. Multi-sectoral approach and synergistic work across various sectors has been the key to COVID response success in Georgia. Health sector received enormous support from all other sectors for implementing social distancing measures, For multi-sectoral response programs to work well, it is critical to have good national coordinating body and a responsibility framework defining specific roles for each sectoral player. Additional ad hoc arrangements in the form of temporary borders or management units may be needed to deal effectively with cross-sectional issues. Nowadays, Georgia is working very actively to further strengthen its health system capacity for better COVID response. This includes activities aimed at building primary healthcare capacity via introducing telemedicine and other distant online consultation modes. We hope that with these measures in place, Georgia will be able to overcome all challenges of the epidemic. I thank you, Chair.
Thank you very much, Georgia. We have now completed the list of speakers from member states as well as partner organizations. We have received a number of written or video statements from non-state actors for these agenda items. And I'll now read you the list of non-state actors that have submitted written or video statements. These statements can all be found on the website of the RC70. We have received statements from the World Federation of Neurology, from Alzheimer's Disease International, from Thalassemia International Federation, from WONCA, the World Organization of Family Doctors, from the World Federation of Occupational Therapists, from the International Federation of Pharmaceutical Manufacturers and Associations, from the International Federation of Medical Students Associations, from the Secretariat of the WHO Framework Convention on Tobacco Control, from the International Atomic Energy Agency, from the European Association for the Study of Obesity, from the World Federation of Societies of Anesthesiologists, and from the Euro Health Net. We have also received a number of joint statements, and one joint statement is from the International League Against Epilepsy, together with the International Bureau for Epilepsy. Another joint statement is from the International Pharmaceutical Students Federation and the International Federation of Medical Students Associations. And finally, we have received a joint statement from the International Society of Physical and Rehabilitation Medicine, together with the International Spinal Cord Society, Handicap International, and the World Federation of Occupational Therapists. So before moving on, I have just been informed that we also have an intervention from Slovenia that unfortunately we missed during this the previous discussion. I'm sorry about that. We will take that video statement under the next session. So this now completes the interventions of the two agenda items of the addresses by the Director General and by the Regional Director. As there have been a number of comments made and also specific questions raised during the interventions, I will now ask the Director General to see if he wishes to take the floor, and followed by the Regional Director. Dr. Tedros, you have the floor, please.
Thank you, my friend Dr. Brostrom. I would prefer actually if RD starts, and then if there is anything I can add, I will add. Please, that would be better, because this is his regional committee meeting. So I will add to whatever I can add later.
No, of course,
Thank you.
Thank you very much, Dr. Tedros. Of course, I will then pass the floor to the Regional Director, Dr. Hans.
Thank you, Executive President, and my great appreciation for the many very impressive and powerful interventions. But first and foremost, thank you for the many messages I got commending on the presentation and its innovation. I would like to assure you that we'll be very feverish on, during the next 5 years, putting innovation really at the forefront. I tried to club the interventions according to the 3 pillars of the GPW and draft EPW. And of course, I tried to look at a denominator, not to go consume too much time. So let me start with the emergencies, as we are still in the midst of the pandemic. So the fact that you acknowledged the WHO response globally and the European office indeed reaffirms how seriously, as a regional director and as the staff of the regional office, we have been taking the pandemic, and hence we reprofiled the office. Definitely, there is a joint acknowledgement by the member states and the secretariat of the work of the health workers. And I am also, in fact, inspired by several interventions who would support that we extend the year of the nurse and the midwife into 2021 and even enlarge it. I think that's a very, very wise decision. In fact, we are actively supporting the Health Worker Charter Initiative for the World Patient Safety Day, and focusing specifically on the mental health and the psychosocial support for the health and care workers. Because if we leave no one behind, we definitely should not leave our health workers behind. Building trust and community engagement and risk communication, particularly as we feel a fatigue across the WHO European region in several countries to the public health measures, is being flagged as a main priority. And in fact, we started already to work on that one. Capacities in the health emergencies need to be boosted up. And again, here, we welcome very much the newly established GDO in Turkey. Preparedness is key, including reviewing the IHR. And I see a clear link here between the different GDOs. Because the primary healthcare has been mentioned many, many times, but also the need to catch up with NCD services, so for patients with non-communicable diseases, but we also know the link between emergencies and climate change, the need to reallocate within existing government budgets the health financing, so the financing work is also very important, and then the inequalities and the gender, which particularly the GDO in Venice is working on. Building on the innovations during the COVID was mentioned a number of times, changes in the health worker roles and in the digital health space to build back better. So that was a number of the main points I held back from the emergencies. Then the next pillar is on universal health coverage. So we are indeed very much investing and willing to further invest in our capacity to provide support to the member states on the ground to strengthen people-centered primary healthcare within a holistic health system and public health agenda. In fact, within the Universal Health Coverage Partnership, already we welcomed 6 additional policy advisors on universal health coverage in the countries. We take very much the operational framework on primary healthcare as a guidance, which comes directly from the Astana Declaration on primary healthcare. And the dual-track health system response, we are going to further boost, because the non-communicable diseases were mentioned, but also a number of times the need to further increase transparency in the agenda of access to affordable, innovative medicines. And as Dr. Björn Inge Larsen mentioned, we are moving forward, also within the COVID, with the high-level conference on access to affordable, innovative medicines, the beginning of March in Oslo. Of course, we have to see on the situation of the COVID-19, but in any case, whether it's a hybrid or whatever shape, we are moving forward, together with the agenda of the AMR, antimicrobial resistance. The third pillar is looking to the future, is the health and well-being, is the agenda of the economy of well-being. We are very committed to the agenda of the economy of well-being, which in fact means to have a society where people are in the center, living in a fair society, environmental friendly, and where everyone has a social safety protection, and where health is not seen as a burden, but as a job creator, first and foremost for those people who are hit hard by unemployment during the COVID. A number of points which came there is gender and addressing the needs of the vulnerable groups, including the elderly and the children, the agenda of the sexual reproductive health and rights, migrants and refugees, and then, which I found very encouraging, I mean, a clear message from your side, but in principle very encouraging, that many of you reiterated support for the need to strengthen multilateralism and WHO in line with the lesson learning from the COVID. Of course, rightly so, following a dedicated reform in line with the recommendations of the independent review. And as I mentioned this morning, we are very committed as a regional office within A1 WHO to contribute and link with the Monti Commission. The independent review will first and foremost look backwards, focus on the COVID and emergencies. The Monti Commission goes very broad, is on health and sustainable development. How to strengthen the health dimension in the sustainable development agenda, and is forward-looking, and Dr. Tedros straight away had appointed a focal point from Geneva to link between both. You also recognize that this means strengthening the funding and collaboration from the member states, which is indeed very encouraging. And an end point on our joint commitment to the COVAX facility. The COVAX portfolio is the broadest in the world and constantly expanding. So we are very eager to see countries still joining the COVAX facility, which will allow the countries an access to a very broad portfolio of the candidate vaccines. This is not only the best thing to do, but the smartest thing to do. So all the countries are indeed encouraged to join the COVAX facility, including those that have already bilateral deals with the manufacturers. And we really welcome as a WHO the European Union's participation in the COVAX facility in support of low and middle income countries, because it is a global public good, and as some respected member states mentioned, it shouldn't be just on the paper. Finally, maybe the core message comes back to stronger health systems. Stronger health systems mean stronger health security, and the call for solidarity. I further commit, like I did 1 year ago, to conduct the work of the regional office in full transparency, consultation, under the guidance of my governing body board, the Standing Committee of the Regional Committee. And the word humility was mentioned. In fact, there are two principles that I mention always to the staff we should take forward in our work. It's humility, but at the same time, a lot of determination. Thank you.
Thank you very much, Hans. Dr. Tedros, do you wish to comment?
Yeah, thank you. Thank you so much. Yeah, I'll be very brief. I think we're a bit late. We were supposed to end 5 minutes ago, but thank you for your excellent leadership, Soren. First, on the one thing I wanted to add is on the 3 pillars of GPW, as Hans said, the health and well-being, UHC, and then the health security or emergency preparedness and response. These are the 3 pillars based on the transformation we did. And we have opportunity. The reason I'm saying this is many of you have raised the best way forward now is to invest in the health system. And we have seen that you said, you have seen the centrality of health, which has been there, as you rightly said. And we have opportunities now. As you remember, last year we endorsed the UHC political declaration was declared by the UN General Assembly, and then the Astana resolution on primary health, Astana declaration on primary health care. And the UHC resolution was actually endorsed by the Inter-Parliamentary Union, by our parliamentarians all over the world. So this is, I think, a very good opportunity, and we may need to move on that. And all these documents also underline the importance of public health. In this pandemic, I think one of the visible weaknesses we have seen is weak public health. Even in the most advanced world, where medicine has advanced significantly, and things that we never thought of before are being done. But the basic public health are neglected. I think the investment in public health will be very key. And this is agreeing with what you have been saying. And then on COVAX, the only thing I would like to add is, Hans had already said, to thank you, because when WHO proposed the idea, the ACT Accelerator, the support came from many European countries. You remember the discussions we had at the initial stage. And especially I would like to identify 3 countries up to the leaders level who participated directly, who led this directly at the initial stage. And these are Chancellor Merkel, President Macron, and Prime Minister Johnson. They were, especially Prime Minister Johnson, while even he was hospitalized, he was following up on this. So just wanted to use this opportunity to thank the European Union for Europe at large, for your commitment to this. And hopefully by Friday, we will see more and more countries joining. And the principle is we need to have this vaccine to cover the targeted population in all countries than the whole population in some countries. This is in the interest of even the advanced countries, because when the world opens up faster, the economy opens up or recovers faster. And the livelihood is, I think, very important for everybody. Trade and investment will come back to life if we do that. So that's why you sponsored it from the start as global public good. I think the Europe's leadership on this continued leadership will be very important. Then the third issue I'd like to say a few words is on the Franco-German non-paper, which we accept full-heartedly. A good number of those were actually aligned even with our transformation, the ideas in our transformation agenda, whether it's the IHR or the universal peer review that was proposed by Africa Group and the rest. So it's really aligned with the transformation, and we fully accept. And I fully agree with Minister Spahan and Minister Olive when they said, and others also, let's start to do things that we can do now, quickly. And that's very important, while also doing the proper, panel evaluation. That's the IPPR. Things that can be done today should be done today. And we're fully aligned on that, and would like to appreciate your support. And the last part is on the IPPR itself. On the IPPR, of course, we will have a session, the board session soon. You will see the whole process then. But one thing I would like to assure you is it was done based on the Assembly's resolution, but we even did more because we thought this is unprecedented. And the people we serve need even more, deserve more. So many of the things we have done in building up the IPPR was not even requested by the panel. But because of the commitment we have to independence and impartiality, we have added many things that reinforces the independence and the impartiality of the panel. And we will, I think the panel itself will brief you the details, but what the resolution says has to be respected. But I assure you that we have even delivered more, because our member states and the people we serve deserve more and better, and we will continue to learn from what we are doing and do even better. And as what Clement said, we need to look forward. I fully agree with him. on the specific issues he raised, we can discuss on that also when we meet. But one opportunity that we have is, every Thursday we have a member state session. And the reason we have a member state session every Thursday is for you to suggest anything. That's your time, 2 hours every week. So if you need a meeting of this, you can suggest, or a meeting of that, you can suggest, or any recommendations you have, whether it's about the board or anything, you can suggest during that briefing session. That's why we are having the every Thursday meeting with you. It has never been done before. The reason we're doing it is because the situation is unprecedented, and we need your continuous advice and support and input. And that's a bit informal, but that's where you can suggest also formal things if you want to, because we need to listen to you, and that's why we have the every Thursday. So please use that. If you have any suggestion it could be for the pandemic or other issues. So thank you so much again. Really appreciate all the inputs. And this is a very special time, and needs our cooperation, solidarity, because the virus benefits from cracks between us. We can only defeat it through cooperation and solidarity. And that's why we have been saying from the start, solidarity, solidarity, solidarity. Europe is a good example, but we want you to influence the whole world to really come together and strengthen the cooperation and solidarity to defeat this pandemic as soon as possible. But while fighting this virus or pandemic, to build back our world even better in all respects, because it has exposed all the measures of inequality, by the way. And we have to address all issues, not just health, and can only be done together. So thank you so much again, Soren. Thank you for your excellent leadership, and thank you also to all member states who have joined today. Thank you. And our colleagues also from sisterly UN agencies and civil society and others. Thank you so much.
Thank you very much, Tedros. It's a great honor for all of us to have you attending our regional committee for Europe. And I will also be very honored to see you back in Copenhagen sometime in the perhaps not too distant future. So thank you very much to our Director General.
I was planning to come actually, but I couldn't due to some problems. So
yeah, I know. Yeah, travel is a little bit difficult in these days.
Thank you.
Thank you. We can now consider the adoption of the proposed draft resolution, which is contained in document EUR/RC70/conf.doc/1. Revision 1. This is on the report of the Regional Director on the work of the WHO in the European region. So is the Regional Committee at this stage willing to adopt the proposed draft resolution by consensus? I see no objections, so the resolution is adopted. With this, I would also like to close agenda items 2A and 2B, and thank you all for your excellent cooperation. We are only running slightly behind. Before we move on to the next agenda item, and we will resume with agenda item 4, we will now have a short break of about 15 minutes.